Okay. Good morning, Samantha. All right, 11 a.m. Monday morning, March 23rd, 2020. We need to call our meeting to order and first have our Pledge of Allegiance, please. And I believe there are no public comments this morning, so we'll dispense with citizen input at this time. Citizens are able to email us if they do have questions for us. Please reach out to our email, board@deschutes.org. Our consent agenda?
I would move approval of the consent agenda.
And I'll second it.
Any further discussion? Commissioner Henderson?
I vote yes.
Mr. DeBonne?
Yes.
And the chair votes yes. Okay, we have action item. Thank you. Yeah.
Yes, Commissioner, we've added, as what we would hope would be your first action item, it's the annexation to the River Forest Acres Road District. It's technically it's a public hearing that the board would open, receive any testimony. We don't anticipate any, although the folks involved with this are watching online. This is a formality that goes through the county commissioners. It's already been through the clerk's office and the assessor's office and community development to verify the appropriate signatures of landowners and properties, and that the annexation would be deemed consistent with the county comprehensive plan. This simply brings two properties into that road district, and by processing it before the end of March, they're able to work with DOR so that those assessments will be on the tax in the fall when the roll is posted. And again, so staff's recommendation would be to open the hearing, call for any testimony if anybody chooses to reach out either by phone or by email, and then hearing none, which is what I would expect, would ask the board to close the hearing and approve the order.
Okay, you're here representing Pauline then?
Yes.
Okay, wonderful.
Commissioner Dara, maybe you could, I don't know, are we online now?
Yes.
From that camera, or, okay, maybe we could you could give a little summary of what we're doing today that's different and nobody here, and just so that anybody happens to be watching, they know what's changing or how it's changing.
Yes. Good morning. Yes, we are following the directive of our state government that we are carefully practicing social distancing. We are still available to hear from you, the public. We are available via email and also phone. So if there are issues that you need to reach us at, please know that you may do that. Our departments are available by phone, and that will be clearly posted on our website. So if you need to reach someone, please do that, or reach one of us, one of the three commissioners, and we will facilitate your request as quickly as we possibly can. So today we're here with a very small but important group of county employees. We have our legal, and we have our administrator, and the three commissioners. So know that we are serving you, our citizens of Deschutes County. We have the public hearing, which I need to open at this time, and this public hearing is in regards to the annexation to River Forest Acres Road District and consideration of board signatures for the order number 2020-009, which is to approve the Mallard Drive annexations into River Forest Acres. It's now been opened. Legal, do you have anything further you'd like to?
No, I believe I provided the staff report previously. County departments recommend board approval of this. The two property owners that would be subject to this annexation and subsequent taxes for the road district are also in approval, as is the road district.
So you're basically saying there's no opposition from the people affected by it?
That is correct.
They are actually asking for this.
That is correct. They're asking to be annexed in.
Okay, and there's this will just enlarge a road district by, what, 2 property owners?
Yeah, these are 2 contiguous properties that will now be taxed accordingly with the other properties in the district for that road district activities and services. And these folks want to come into the district, and the district wants them.
Great. How many residences are in that road district? Do you know how large it is?
That one I'm not sure of. Pauline was handling this, and I have her working from home today, so I don't believe it's terribly large. I want to say 40 properties, maybe 50. Commissioner DeBonne might know, it's down in your.
I wouldn't know the number offhand, but they are larger parcels. There's kind of a loop road plus access north, south, and east probably that are maintained, some gravel and these roads. But I wouldn't know the number of parcels. Oh, good. So let's stand by. We do have audio trying to come in. The audio level is low, so we're going to turn that up in the room right now. May I ask you that?
Can you repeat that, please?
Introduce yourself also, please.
Pauline?
Maybe it was someone that wasn't on mute.
Would it be Pauline on the line?
I don't believe so.
Okay.
Okay. Oh, thank you so much.
Yeah, it's real quiet in our,
Yes.
Need to unmute and mute it.
Are you there?
Oh.
Hello?
okay, well, we heard Chris McLeod, secretary.
For the River
Ask if
District.
she can hear us. We tell her we can hear her.
Good. So it sounds like the road district board is, or a couple of them at least, are on the phone. The volume is very low in our conference room.
Why don't you, we can hear them, but can they hear us, I guess?
No, they said they're only getting part of our conversations.
Well, mine looks like it's turned off. See, yours is green, Commissioner DeBonne.
The different microphones. When you push it, mutes it temporarily. So that, yeah, you just don't touch the mics.
Well, I have about 6 times, so
Well,
I'll
We
honor
can hear
'em.
you from the website,
There you go.
so if you ask a question, there's about a 10-second delay.
Okay, excellent. Thank you.
We were able to figure out the volume control just now, and now it's louder in here.
That's okay. So I did ask how many homeowners are part of this road district?
Excellent. Thank you.
We were able to figure out the volume control just now, and now it's louder in here.
That's okay. So I did ask how many homeowners are part of this road district? There's about 75.
Okay. Okay, so an additional 2 then.
That's correct.
Did you need to make any other comments for our group?
It takes about 15 to 20 seconds.
Did you need to make any other comments for our group? No. No.
Okay. Thank you. So therefore, may we now close the public hearing and proceed with, at this time, we can close the public hearing, close the record, and actually take action, voting? Is that possible?
That's correct, on order 2020-009.
Okay.
So are we, it's not title only or anything?
Nope.
Okay, so I'll move approval of order 2020-009, an order approving Mallard Drive annexation into River Forest Acres.
And I'll second it.
Any further discussion?
I'm familiar with the area, and I'm glad to see that they're doing this inclusion.
Thank you. And Dave, did you say that this has to be done by the end of the month in order for any additional homes to go into road districts? Is that correct?
Yeah, to qualify for the tax roll in the fall, it would need, DOR has to have all the paperwork by the end of the month. So we'll get the signed order from the board at the end of your meeting today, and we'll make sure it gets scanned to all the folks, including the Secretary of State and the Department of Revenue that have to have it.
Okay. Thank you for that clarification. Commissioner DeBonne, did you need to say anything? Okay, Commissioner Henderson?
I vote yes.
Commissioner DeBonne?
Yes.
And the chair votes yes. So thank you very much.
Thank you for letting us expedite that.
Well, that's nice to know they'll now have 77 homes in it instead of 75. It's always helpful, isn't it? Okay. The next item on our agenda is a grant application from Jennifer Hill. Who would be presenting that?
Our understanding is they're not here presently. I'm not sure if anybody from the sheriff's office is on the phone for this item.
Well, you know, from my perspective, the memo in support of it was pretty thorough and explained what it was. I had a couple questions, but they were just informational questions about the statistics that they're reciting, et cetera. So I'm prepared to go forward if there isn't a presentation.
And acknowledging this is an application, we'll have the opportunity to hear more about the program if approved, which would be prudent for us to understand the business of this grant.
I'm happy to pass along any questions the board might have to the sheriff's office to provide a written response.
Well, the thing that I was interested in was the number of, there's a statistic in here, the number of dispatch calls involving citizens with mental health issues has increased 367%. And I was wondering if that's because, that seems like a huge amount. That's almost, whatever you're doing now times 4. In the population that's growing. I wonder if that had to do with the definition of mental health issues being part of what is now added to the write-up of a case or something, because it seems like we've had that change. I'm not, and I'm not sure. This is really, as I understand it, money for peer support for people actually in law enforcement and their stress, not for the people. So it's kind of an unrelated question, but I thought the statistic was notable. So I just was curious about how they got the statistic. But I understand what they're attempting to apply for, so it sounds good to me.
Well, and I'll acknowledge that the definition of somebody being disruptive in our community or breaking a law, going to jail, everybody there could be diagnosed possibly with, some version of at least temporary anxiety, depression, whatever, the issues might be. So this is changing that incarceration first model to stabilizing and getting somebody in our society, back out, getting their immediate needs dealt with. So understanding that line of what incarceration and stabilization is going to be is something that we're all going to have to do as a society. So as I say, I do support the grant application and a discussion following on.
Yes. And the fact that the number of suicide calls had increased by 40%. The good news is people are calling, and maybe in the past, people didn't call and didn't recognize that they could actually get help. So, and law enforcement, this is something they deal with on a daily basis. I think this is critical, and for them to have as much mental health support as we can give them, I think is very important. So, did you actually make a motion then to
I
approve?
will. I'll make a motion that we approve the grant application for the 2020 Law Enforcement Mental Health and Wellness Act Program Grant.
And I'll second it.
Any further discussion?
One other question, Tom, I had was, is this a federal grant or a state grant? Just curious.
Okay.
Anyway, nope, that's all I.
Okay. Commissioner Henderson?
Vote yes.
Commissioner DeBonne?
Yes.
Okay, and the chair votes yes.
Thank you.
Okay, now Deborah Cook. Eric, would you like to do that presentation for us?
Yes, good morning, Commissioners. Eric Cross, Deputy County Administrator. I'll do the introduction again. Good morning, Commissioners. Eric Kropp, Deputy County Administrator. This item is board consideration of document 220-225, which is a extension of a revocable license to allow Neighbor Impact to continue operating its warming shelter at the Sheriff's Office Work Center for a couple more weeks. The current license agreement goes through the end of this month. And in fact, Neighbor Impact was scheduled to close the shelter last Monday, but they were able to get additional funding from the state of Oregon, and they wanted a couple more weeks of operating the warming shelter based on the cold weather that came in last week, and also able to transition the folks staying at the center a little bit more, a couple more weeks of transition based on COVID-19. So what this agreement does is it extends the lease agreement through April 16th. That was discussed last week with the board. And I'm happy to answer there was a question from the board last week about how many people were at the shelter. And I spoke to Scott Cooper, the director of Neighbor Impact, and he indicated that after about a month of opening the warming shelter, they were at capacity every night, which is about 48 individuals. That was just a follow-up question from the board.
Any idea how much staff that requires and how that's going with, I think Neighbor Impact was providing the staff, I think, also.
I don't know how many staff members. Scott indicated that it was difficult to maintain the staff just because of the shift work and the hours.
But they are maintaining.
Yes.
Okay, all right. And so if we approve this through April 16th, will they have funding to carry it on longer if our weather stays impactful?
I don't think they have funding to go past April 16th at this point.
Okay, all right. And I know our neighborhoods in that area have been impacted from the residents, but, currently our weather is still, it was beautiful this weekend, but it's supposed to snow again this week. So it's good to hear that they are, 48 people have been using the facility. And I thank Neighbor Impact for what they're doing.
And the sheriff is supportive of extending the license agreement.
Okay. Good.
I'm glad we were able to extend it a few weeks. Yeah, it does look like a little bit cooler weather for this next week coming, but spring's here and it will start warming up. We do have other plans for that facility, the building itself. We do have the stabilization center opening, so I'm excited on the redevelopment as we discuss in the near future of that property also. It's wonderful that we were able to provide it this winter in an emergency situation. Community was asking for 100 beds, and we were able to provide these 48 during the depth of the winter. There were some cold nights out there, but yeah, I do support transitioning away from this facility being that warming shelter also, and being a partner for next year. And I don't see it being at that location, but next winter, we'll see what we can come up with.
My only thought is that, if the weather were to continue cold at night, it would, I'm open to talking about whether we continue beyond the April 16th, but it's our goal to try to, I think, shut it down once we're into a warmer period, so. And
I'll be happy to let Scott Cooper know that if something
That's me, I don't know.
change, that
Yeah.
the board is open to further discussion.
it just seems like we'll just see how it goes, and
Well, and I'd support a week-to-week discussion at
Yeah.
that point. I mean, because transitioning out is the goal at this point, so.
the other thing, because I don't know when we'll get back to this, is that, really any effort for next year's planning should start now. And I hope that group that all got together with this cry for help in October should be meeting in April, because we've made it pretty clear this isn't the place for it long-term. And so I don't know how we get that. Maybe we get Colleen and the Homeless Leadership Coalition to call a meeting to talk about next winter's warming shelter
I
plans.
believe they're already working on it. I've told Mr. Cook, who is the co-chair, that they need to start working on it now.
Well, that's good.
Or
You've
last-
told him, and we've told him. but
Right, we told him
what-
last
Is
year.
that happening, is what I guess I'm asking. So-
Well, I've been at some of their meetings, and they, they are, we shall see.
Well, I'll move for approval of board signature of document number 2020-225, a revocable license addendum for neighbor impact warming shelter.
And I'll second it.
Further discussion? Commissioner Henderson?
I vote yes.
Commissioner DeBonne?
Yes.
And the chair votes yes.
Great.
Okay.
I see we've got a long agenda. I don't know when this was made or what, I don't know who made it, but I did have printed out for everybody a couple things. I guess did you print out both the executive order and the email?
No.
Okay, so here's the email that went with it,
Okay.
Commissioner Bone. And then I've got one copy of the executive order here. Do you have the email or the executive order? That's the executive order. Yeah, okay, well,
Okay.
maybe Tom wants that. That's the email that came with it.
I've got that also.
Oh, okay. And then, there's do you have the email, Dave? As well as that's the executive order you're looking at. So that's the email, that was like the cover of it. We also printed out a long, spreadsheet that Senator Finley, who represents the northern part of Deschutes County among all the other places, printed out and gave us for a meeting today, or that we had on the phone conference that all three of us were on, and listing all the things that the legislature is working on. They're having a committee meeting today. And I think I printed out 3 copies. I think we might get to some of this or discuss it a little bit somewhere in the agenda. And then I brought with me all of the things we've kind of received from people and questions that I think will fit on this agenda also. I don't know if they'll fit into this agenda or just at the end, but there are certain people who have requested things, and I thought it'd make sense we'd talk about it.
Good.
That's what I have going into this.
Okay. So did you make a copy of Senator Finley's for
Yeah, it was
us?
in your box.
It was?
And that's an email we have from this morning?
I think, yeah, but I think it's in you may have it in your stack, Tony.
It was printed out.
It looks like this. It was in the box. Megan made copies for us. I don't think I have more than one. Yeah,
Oh, it's underneath the letter.
yep, got it?
Got it. Thank
Okay.
you.
Yep.
All right.
I guess the other thing that was kind of catching up is that the phone call yesterday, before we get to Dr. Conway and all that, is that part of, I don't know, maybe it fits into item 2, but that was kind of relevant. There was a phone call at 1 yesterday. I don't know if you were on that or, okay. So it may be in item 2 on this agenda.
Yes, that phone call with the governor was at 1 o'clock, and it was clearly Eastern Oregon. Boardman was told to keep their food industries still producing, agriculture and food. Yes, the governor at that time said we need to keep agriculture going, we need to keep our timber going with the social distancing, we need our forestry, and actually, and our manufacturing. We have, manufacturing industries in Redmond, such as, what is it, Medline, that does medical things. So, that was part of the phone conversation, and then it promptly ended at 1:30. But we spoke of the necessities in our, in our community and on our side of the state. The farmers have to plant now. They can't plant in August. That won't work. So the governor seemed to recognize the fact that we aren't Portland. So
When you say it was clearly Eastern Oregon, so they just selected a certain number of
right,
counties to
yes.
invite?
If you there was an invite list with 80 people on it, And I went through that list, and they were all Eastern Oregon. Yes, well, that's how she did the last conversation that we had. She started with the Eastern Oregon counties, went through all of them, and by the time, the capacity of that phone call wasn't large enough. So as soon as she got to Deschutes, she said, okay, everyone that's already spoken, you need to get off the phone so we could add the other people in the state. But she started on the east side of our state and went through, Harney. There were quite a few counties on that call that were not on because they didn't get the notice in time. So,
For yesterday?
no, the week before.
The week before I was.
Yes, there were like Harney County wasn't on it, Baker County wasn't on it. There were I think Grant County, there were quite a few counties in our side of the state that were not on that call. But the capacity wasn't there, so that's why the call yesterday was, 80 emails, I believe, received the notice.
Well, one thing we could do, because this came up with me yesterday, is that I didn't see the email Friday that there was gonna be a call Sunday, and then I didn't check my emails till yesterday afternoon, and so I missed it. Maybe we could, and I'd asked if you get a notice, just give me a notice, but we could be doing the same thing for Eastern Oregon counties if we think people might not see them, It isn't automatic that everybody gets everything, and so, and maybe it will be on our, I can take my laptop with me everywhere. I didn't think she was gonna do something yesterday, because I thought she was gonna do something today, because that's what she said Friday night, so.
I think it came out Saturday. I think the email for the call at Sunday at 1 came out Saturday. And so that's a good idea, though.
We
It
could
did
get
seem
it
that people were on the call yesterday. Most of the counties, I believe,
that's
were
good.
on the call.
So I'd like to acknowledge, so Governor Brown tightened social distancing measures, tells Oregonians to stay home, save lives. So this was an hour and a half ago, news release. It's an executive order 20-12. And it has some words, but I noticed it says retail businesses closed by executive order include shopping, outdoor, indoor malls, retail complexes, fitness gyms, sports fitness centers, grooming, barbershops, beauty and nail salons, and entertainment with theaters, amusement parks, arcades, bowling alleys, and pool halls. So the clarity that I would like to make sure we work our way through, and if you can help kind of, it talks about a Class C misdemeanor is a failure to comply option, and I guess that would be public safety that would issue a Class C misdemeanor. But the big question was manufacturing. There's these retail specifically, but the manufacturing companies, I just had a phone call, a company that delivers supplies, somebody that's driving was asking, do I have to go to work if I don't want to, if I don't feel comfortable? Would my employer be required to pay me if I choose to not work? So that's the situation we're in. This week, right now, is when we really need to think about that social distancing and the evolution of how we're going to do business, slowly and separated, just like we are in this room right now. So that's what I'm acknowledging. So let's digest this order, understanding what we're talking about, because we've had very specifically manufacturers come to us and say, are they shutting my business down or not? And who they is the governor's order at this point in time. But we would be the entity, the cities, and my assumption is police and sheriff are the ones that would be making this choice out in the field. But we need real good clarity on what does it look like at this point in time.
Well, manufacturing is not listed,
Yeah.
and
Well, I'm-
agriculture is not listed. She knows we need to clean up the forest. Who knows when, fires don't stop because of the virus.
But I'm
Or we
envisioning,
jumping, that's a whole topic here on this agenda. Do you have this little agenda that was in our stack?
Yes.
So,
So I just-
because I agree with what you're saying, but are we gonna,
No.
seems like we should
Work our way
proceed
through
in
it.
an
We should
organizational
add, okay,
manner,
so
because
we
I have
should-
some questions about some of that too.
Okay, so we should have, Dr. Conway is on our agenda. Dr. Conway, do you want to give us a 10-minute update? I do want you to know that in the community this weekend, I was told that there were quite a few people in Sisters that are the people that are with the virus. I was like, okay, the community seems to be hearing this information. Is the 10th person, is that a travel-related virus too? I hadn't heard that, because I believe we're up to number 10 now for Deschutes County.
Microphone. A lot closer to the microphone.
Microphone, please.
And about half and half are 65 or older.
So it's 50/50 for 65 and over?
So the stat, the way the age cuts work is 64 plus, so it'd be 64.
So are all 10 of these at the hospital? Or at a hospital?
I can't tell you.
Okay.
So we receive them through
Under the wheel.
Orpheus, which is the ones that are not done, that come directly to us, the results shared go through Orpheus, and that the state manages that, and then they come back to us. So I believe we have that information. I do not have it in front of me.
Okay.
So, so as far as an overview goes, I think the inflection is the middle of last week. There was the UK had commissioned the UK had commissioned a very rapid study, mathematical modeling study from Imperial College, I think it's in London, England, to look at the likely case numbers in following the current, early, and I must point out, very incomplete testing data from both, and case data from both countries, UK and the United States. What became apparent is that any reasonable projection without interventions would yield a very high rate of cases that would greatly outstrip, by a number of factors, greatly outstrip the capacity for emergency resuscitation for the most ill patients. So that's the bad news. The good news is that this is modeled without any intervention, and they had multiple interventions that they talked about. Mass gatherings, which they found had very little effect because they tend to be transient in time. However, because of the crowding of people going in and out and their transit, often crossing paths with other people, they recommended that remain constrained. Social distancing, the voluntary quarantine of individuals that are infected with their entire household, closure of universities and schools.
You're talking about the UK currently?
No.
No.
No, the study was done for it was commissioned for both countries. So these are general recommendations, but the numbers that we used were the U.S. numbers. They were made privy to the latest numbers in both the UK and
Because
the U.S.
yesterday was Mother's Day in England, and I saw pictures on my Twitter feed that there were 1 million people shopping for their moms. So it's like, oh my God.
So these were, if you'll just let me walk through this.
Well, I just want to know what country you're talking about, because it's, there's a difference.
Yes, but this is a modeling study that was released early last week. I don't know what the UK has done with that information. It's outside, it's on the other side of a ocean from us. What I do know is that this was what prompted some of the rapid public messaging and outputs from our federal government. I know that Dr. Master and Dr. Debbie Birx, who's the COVID czar, is reporting directly to Vice President Pence, and Dr. Anthony Fauci were both aware of this, and I believe it was one of the things talked about in one of the press events, I don't know which things are called which, of the advisory group that's been stood up ad hoc to work with them. So it became very clear that if with such interventions, if we do all of those things, that there's a very good chance to keep a much flatter curve and stay within the emergency capabilities of the average locale in the United States. Now, we know that there are certain areas that already have very high reported case numbers. Those include Seattle area, Seattle-King County, New Rochelle, New York, which is a relatively small northeastern suburb of New York City. Increasing case numbers in New York City. Very high case number rates in New Orleans, Louisiana, and the governor has issued a very sort of grave state of emergency in Louisiana over the weekend. And then there are many other places where they're starting to seem to be much higher numbers. So each of those areas there's been a combination of containment to the extent possible and social distancing, and they also, each of those locales, I don't know about New Orleans, but New Rochelle, New York City, and the Seattle-King County area, and then certain areas in California have been so far heavily affected, are doing their best to roll out testing. So whether or not it's early enough to foreclose that sort of awful effect in the places that are already badly affected is an unknown. I'm not privy to any information one way or another predicting that. But in places that are not as densely populated and don't appear to have been afflicted with so many clinical cases so early, so the threshold for testing in most of the country is people have to be very ill because tests are basically being rationed. They either have to be already an inpatient or they have to be high fever plus very obvious respiratory difficulties. So we have no idea of the underlying case rate. We have no idea of the percentage that are asymptomatic. We won't until we have widespread testing. But the evidence is compelling based on these models and looking at what Korea has done, looking at the second wave of effort in China, looking at countries like Taiwan that have been able to very much contain the few cases that they got, that's possible. The flip side is Italy is a cautionary tale that appears that the disease probably first emerged, viral infections in Italy, possibly the first anywhere in the world. There were a large upsurge in people with a lower respiratory infection who were very ill, many elderly deaths starting in late November in the northern region of Italy, Lombardy. We don't know because the international garment industry is connected between northern Italy, where a lot of the design is done, higher end work, and south central China, whether or not the virus transmission in the two locales are related or not. I doubt we'll know that for years.
Well, I've heard a report this morning that there's a lot of people moving back and forth historically between that region of Italy and the Wuhan province, and so so you're saying that's one of the reasons it got ahead of of all the other areas is the amount of traffic back and forth, and we haven't had that same traffic with either region.
Well, we haven't had as
same
much.
amount. I mean, they're talking about hundreds of thousands of people.
Yeah, right. There's often full jets that come from northern Italy into south central China because the largest manufactories in the world are in south central China from Hubei province, where Wuhan is, south into what's called the Pearl River Delta, and that includes Guangzhou, Shenzhen, and Hong Kong. So the largest, busiest manufactories in the world are there. The other major travel to the garment industry and some other high-tech things from Italy, but the other very major set of travel is from U.S. and Northern European high-tech industries into that area and also Shanghai in the eastern part of China. So I mean, one of the things we learned this during the AIDS epidemic, that aircraft are very efficient ways of transmitting viruses across international borders. So just not to perseverate on that, the cat is out of the bag as far as that. I don't think there are that many places that can effectively entirely eliminate the chances of the virus already being within their borders. I think there have been reports now from over 150 nations, and there's only about 100. I think there's 186 registered with the UN, so the great number of nations have done it, and many of the others may or may not have any testing. Anyhow, so the plan and what's been talked about and what is now being promulgated in many states, and including, as far as I understand, our own now with the new government orders, is to basically bring to a halt all human interaction and commerce except for things that are absolutely necessary for maintaining the safety and well-being of the population, the at least fundamental elements of the economy, including, as you mentioned, agriculture, public safety workers, supply chain, so people have to have groceries, they have to have medicines, and then the infrastructure necessary to deliver and provide those. And I think internationally, at least the developed nations are saying that it's worth a very, very high potential investment in economic mitigation to take this sort of very limiting measure to constrain society for long enough, hopefully, to slow the transmission down and greatly reduce the hazard to particularly elderly people and people with chronic diseases who have been advised the last week or two to shelter in place, but having less circulation is expected to greatly reduce the transmission rate. This is something that we'll have to do. We'll have to see what happens. We won't really know the effectiveness of this until we have widespread testing readily available for all people that are clinically ill in the United States, and we don't really know when that'll happen. So that's really the general picture.
Please press any key to remain in conference.
Sergeant Garabay from the Sheriff's Department is co-chairing our incident command system. And he's prepared to give us a sit stat of the more granular nature and some of the logistical status. Sorry.
Well,
Could I ask a
Oh,
question?
and actually, I'm sorry.
I just want to know, can you get back to us and let us know, are those 10 people, are they in the hospital or not? I want our community to know that.
Oh, I thought you were asking who had tested them, what.
No, I asked if I want to know if they're in the hospital or not, if they're having a bad case, or are they just sheltering in home and, their oxygen level is above 93, things are, they're getting over it, but they're taking care of themselves in their
I
home.
understand the question. It changes daily, so we'll check and we can.
Yeah, I just think it would be important for our
understand For
citizens.
sort of a humane reason. I didn't understand the question before. And actually, I was remiss. I do want to make an introduction.
Yes.
This is Mr. Nahad Azodi, if you want to stand up. Mr. Azodi is our new public health director. He very kindly offered to come early and start working in the response with us. He'll officially assume his duties on April 1st, another auspicious day. But he's been jumping in and helping from a few days after he arrived with his family. So I just want to introduce you.
Thank you.
Welcome to Deschutes County.
Yep, I was gonna say welcome. I would have stopped and probably said hi before the meeting. We're just not in that mode right now, but nice to know who you are and thank you for joining us.
I'll point out that Nahad has very extensive experience with the U.S. Centers for Disease Control, the World Health Organization, UNICEF. He's a well-known international expert in immunizations and public health, as well as equity. He has an excellent training film that was made, I think, for UNICEF on equity, which is a major issue, social determinants of health. He also worked 4 years for the Chicago Health Department. So he has substantial domestic experience as well. We're very, very fortunate to bring him aboard, and he's planned his arrival for a very busy time. So he may have very good planning skills, too.
And I do want to actually recognize that Hillary Saraceno said that she's going to stay on and help in this critical
Yes,
time.
yes, and
I appreciate that.
I greatly appreciate it, too. Yes, she'll switch to an on-call status, but we expect for her to be heavily involved. And one of the things I didn't want to do was have Nahad arrive and immediately be saddled with the, dare I say, high-risk game of the whole budgeting process. So Hillary's agreed to stay on through that and to provide for safe transition or effective transition.
Before we get to the next presentation, I was going to just follow up a little bit with you, Dr. Conway, and some things. A lot of what you told us, kind of the state of things, is what I think Tom, Tony, Patty, and I were all on the call Friday when you went through that report, and so we appreciate you bringing that up again with regard to the study. And it's kind of, clarified what we're trying to do and what we think we're trying to do and why it makes a difference. And I think it's good that other people know about it. And I like the idea that Tony had about maybe doing a video where several of us talk about parts of it. We could get a script together and that would be available on our website about why social distancing matters. It's a simplified version of it, so that'd be good.
If I can add something, sir. one of the sort of fundamental scientific principles is that we never take one group's word or one set of investigators' word for anything. So over the weekend, there have been a number of other similar modeling efforts made, and so far they are confirmatory of the same concerns. The numbers vary, the inputs vary, but the pattern is very, very clear. And the reason that we're able to do that is because ground zero, the worst places where this virus stuck originally were in China, central China, and then in Korea. So they were very athletic in their response, and they've shared very gracefully a very substantial level of measurement. So they can use that to impute. The UK has set up a very good case reporting system. And then once again, the cautionary tale is Italy, which because the virus is believed to have started replicating earlier, November and December, they're further along on that curve, and they're having the experience that we're doing our best to avoid, which is that it's rapidly overwhelming all of the upper end of their medical care system. Sorry to interrupt.
No, and I think that's what the chart, that's what the modeling, represents. Last week, we did a lot of discussions at our updates about testing, needing to do additional testings. First meeting on Monday, we didn't have much going on. We were pretty frustrated. You were frustrated about the ability to get things going. It sounds like by Friday, BMC has got things going. St. Charles is upping the number of testing they're doing. We heard about the private clinic, High Lakes Family Care, I think it's called, and Redmond working on some ways to do it. It seems like we've progressed quite a bit. And I was wondering if you have continuing frustrations or anything we can help with regard to that. It didn't sound like the two private. I did follow up with was it Sarah, I think, and Pamela maybe, about the one's private LabCorp, and it sounds like the test turnaround was too long there. It's 5 or 6 days or more, and then, but can you give us an update on what's breaking news, where are we headed in that, et cetera, and if it's still as important as it was?
Well, to summarize, there's no breaking news. We're still doing a very inadequate job of testing. There have been many efforts to stand up the capability. There is testing going on, but it's very severely limited by the availability of test kits and swabs, such that basically only people that are clinically quite ill are getting tested. St. Charles has a very explicit clinical criteria. They had to ration their swabs, so they've withheld a certain amount for occupational safety and health testing if their workforce becomes exposed. And then of the remaining swabs, and that's currently a limiting factor in additional test kits, about half of their, and they've published these, this is public information, about half of those are held for patients that are inpatients, and half are people that are outpatients, but these people have to be quite ill. They have to have a fever, they have to have cough, and at least one other symptom of potential impending serious illness. So we're not, there's a few reasons to test. The one that's being attended to some degree right now is having an accurate diagnosis for people that are gravely ill, that might need resuscitation, or people that are very ill, that might require medical care, which could place other workers at risk. If you start, pumping high volume oxygen or whatever in a room, it's a general room and you don't take precautions, and you could end up with a lot of your staff infected, even if they're wearing some degree of PPE. So we're doing that, but as far as being able to test enough to have any idea of the extent of the problem in the population, of any extent of its growth, and then knowing where granularly to try to constrain its growth, and then follow whether we made any progress. I would say it's reasonable to assume it'll be weeks before we have that. The thing that's coming online now is a couple of things. There's some rapid testing that's now been authorized as a add-on to one of the rapid PCR sets. There's point-of-care testing, which is a slightly different technology that is a little bit more simple, that may permit more rapid testing while patients actually wait an hour or two. But there's no volume of any of these things. So, and I don't know that in a place like us, where we're not at the epicenter of any of the serious outbreaks in the United States, I'd be surprised if we're placed first in the queue when those things are available either.
Okay. So I guess my understanding was that those entities were doing some things, and they weren't
They are.
clamoring for our help or anything else, and we're not doing anything independently to set up a testing
We're doing
or
everything.
swab.
We're doing everything as a consortium to assist. So we've offered to help staff efforts as needed, and if there's a central point of testing that develops, we will assist that. The main thing we've spent a great deal of time trying to do is find out and help promote access to testing and swabs and back supply of PPE, which is essential for the people doing the testing. So, and we have, University of Washington has published the protocol for standing up drive-through testing. It's been implemented in a number of locales, including in Anchorage, Alaska. They did 150 people a day last week in Anchorage, but they have better supply lines than we have.
Okay, so you've shared some of that on, we got that report that you handed out about the tests that University of Washington actually set up its own testing
Yes.
drive-by for its own employees for university.
Yes, and then they've
So,
extended it to-
so they have a model, but so did Douglas County. I mean, we're hearing other.
Tony, it's your
I guess what I, we had a phone call with all the counties last week, and one of the things we learned was that some counties felt like their medical community was doing enough testing for their medical community. So I'm wondering if we need to do something. Again, I asked a week ago, and I'm asking you today, is there something we as a county can do beyond what you're doing coordinating these groups? I mean, can we, like, specifically, I asked, I called the one company, talked to the person up the chain. Then when I talked to your staff, it seemed like they didn't think that was going to be fruitful to get more. But maybe it could be fruitful. Do you want us to keep working on that, or or is there a way we can help somehow? I mean,
If we knew the secret to how to get more swabs and kits, we'd already be doing it. So we appreciate everybody asking. Maybe one of these will pan out. The fact is, there's a national and international shortage. We had a conference call with one of Representative Walden's staff on, I think it was Thursday.
yeah, we were all on it.
Yes.
Okay, well, so they said there are 2 million swabs, and I think the logical question to ask is, well, who is the jobber on the East Coast that's receiving it, and how are they being distributed? But the person we were talking to either wasn't privy to that or was reluctant to share that information, kept telling us to talk to local suppliers.
Well, let's stop there, because we're the ones that got involved with Congressman Walden. We know the people that work for him, and we knew he was on the line. We know him. So when you say somebody wasn't privy to something, who are you working with?
No, I said I didn't know if the person we were talking to was privy and reluctant to share it or just didn't know. But what?
Well, have you asked us to ask them that? I guess do you want us to ask?
I asked everybody who was on the call very directly if it was possible to reach out and find out where they were coming into the country, if there's some way we could intervene. Because the person that we were talking to, I'm sorry, I don't remember her name.
Morgan.
Staffer,
Morgan.
kept saying that
Healthcare.
check with your local suppliers. We are tormenting our local suppliers on a daily basis. We are calling all of them. St. Charles is doing the same. The problem.
Saying we, is that your staff people, the people?
No, it's collectively, all the clinical partners are on the call on Friday afternoon. So the weakness is not in our community. All of the available clinics, many have already stood up testing capability. Many are poised to do it. St. Charles is willing to stand it much more. The problem is a supply problem. There is not enough swabs and there are not enough tests. Until we have enough swabs, enough tests, those people cannot fulfill the capabilities that they have organized. There's been a lot more progress made in the last couple of weeks in organizing all that.
See, that's what I'm trying to get at. So we have the capacity that you feel like there's enough places that have stood up testing or swabbing ability. So now we're still waiting for swabs and places to send the swabs for results. Is that kind of the simple?
I think
Is that okay to say it that way?
Most of the community providers, including our hospital, have stood up a system which is able to do much more volume than we have. However, once mass testing becomes available, I do not believe what we have currently would be enough to do that. But we're talking about some shared setting or distributive model setting that could handle much more volume. But the limiting factor, as soon as we know that there's test kits and swabs on the way, it'll probably take 2 or 3 days to get here. In that time, we can stand up capacity to do this. Now, we still have to organize how that happens and what the public notification is. And the big problem is what we do want to do is be able to test everyone that's ill so that we know to tell them to be cautious in potential transmission, and also so we can start following people that might become much more ill, people who have an underlying risk. What we don't want is we don't want everybody that's worried about coronavirus that's not ill demanding a test, because it's a pointless exercise. They could get a negative test and be ill 3 days later. They could get a positive test, but it's very unlikely if they're feeling well. It's possible, but very unlikely. So we don't want to have just the entire population coming and clamoring for tests immediately. But to be honest, I'd like to have the problem of having enough swabs and enough tests that we could start figuring out the fine points of that, but we're just not there. And the way that things have been going, I'll be surprised if we can get there soon. I mean, the immediate constraint right now is more swabs than test kits, which is also a constraint, but the immediate one is swabs. So if there's any way of getting, as I said on Thursday, any way of getting hold of a tranche of a few thousand of those swabs, that would make a huge difference.
Dr. Conway?
Yes.
I was on the phone Friday night with the FDA for their 24-hour phone call. Got a hold of them, got the information, their update as of Friday. And then I actually spoke with Dr. Rose Kenny, who's working on the testing in Redmond. And according to her information, she had already put in a huge order like a week and a half ago. So with the company that's actually a recognized U.S. company, it seems like she's really trying to implement something going on. But I've talked to a dermatologist today, her doctor, who thinks she's going to have to close down. And she was telling me that she really wants to keep her patients not going to the emergency room, her older patients. She's really trying to work with them so that they don't hit our emergency room. But really what I've heard from a lot of doctors is that they need to have like the flu testing first. We've had 20-some thousand people in America die from the flu this year, and get those tests done first. And then if those tests all come in negative, you should work on the coronavirus.
Yes, actually, the protocol is to test for influenza first.
Correct.
And if the influenza is negative, then to test for COVID. And that's actually part of the protocol from the University of Washington as well. So as far as your friend and colleague in Redmond, I don't recall that information about the supplier being shared on our clinical call. Everyone on that call would love to know where they can get more swabs. I have not heard that, and I'd certainly appreciate that being shared
Okay.
immediately with the other
Okay.
providers.
All right. I will pull it up.
And I think Sergeant Garibay is prepared to give an update on the current situation, maybe a little more granularity to it, all the many things that we're doing. You have in your packet a press release we put out last night to try to promote the idea of staying at home, which may be, I don't think preempted, but certainly more strongly encouraged by the governor. And then we understand the rest of these issues are falling. Sergeant.
Well, good. I guess we're afternoon now.
Oh.
The day flies by, doesn't it? I think at this point, we are, obviously we're still supporting as far as planning for testing capability once it becomes available. So, don't want to get locked around that axle anymore. But ultimately, we're developing some plans around multiple different site clinics that could potentially become testing locations, and so we're developing some plans around those. We are fine-tuning some plans around those. But most of our activity right now is around medical surge planning, working with the hospital system to support their needs, particularly for critically ill patients. And that information is we hope to get that wrapped up today. It's kind of dependent upon quite a bit of internal assessment that St. Charles has been doing, and we have a meeting with them this afternoon, hopefully to get a little bit more I guess, less ambiguity around that. A lot of it has to do with using correct planning assumptions and asking the right questions. So that's what we did last week. They're coming back with us today, and we're going to support them as best we can to meet the needs. We did order those 30 ventilators. We hope to have arrival the second week of April. So that certainly encourages us to knowing how long it takes for things like that to arrive. Everything, as Dr. Conway mentioned, our big messaging is really delay the peak or spread that peak out, because we know that if it comes before we're ready, and it will come before we're ready, but the more time we have to prepare, the ultimate better safety for the citizens.
Can I follow up on,
Yeah.
so what are you able to do to help with medical surge planning? Because I understand that's anticipating more patients needing to go to the hospital. So and I'm saying kind of the county's role, but I know you may have maybe a broader umbrella, but what?
Yeah, I think primarily it's helping identify alternate sites where more people can be treated, potentially lower acuity, or and again, I'm cautious to speak too granular about this without hospital system in the room, because obviously it's their business, but supporting and helping identify alternate locations where lower acuity patients could be seen, or maybe non-COVID patients could be seen.
So you're talking about like exam room somewhere else other than at the hospital,
any
or?
potential place that could hold a patient ultimately.
So you're kind of lining up, you're thinking about different spaces and where that might happen?
Exactly,
Yeah.
and what it would take. We've already connected the hospital system to a number of logistical suppliers to enhance their capability. So we connected them with a provider of hospital, basically a hospital tent, and I think they've already ordered 4 of those with additional bed capacity. So we're trying to just kind of help source them logistically, help findings for them, whether it's PPE. PPE has continued to be a huge challenge. We've been, over the weekend, we were trying to translate documents that were in Chinese, because that's where, the PPE is coming from, if we can get it. So there's a number of challenges around that. But so that's really how we're supporting the hospital. But again, it's thinking outside the box, trying to find locations where we can enhance our capacity. And then also just the coordination of that. So good communication, developing good lines of communication, so that when we do get into a surge situation, that patients are, connecting EMS with the hospital, making sure that those patients are going where they should be going, as opposed to, trying to eliminate the inefficiencies that are inherent in a chaotic situation.
So there's also, besides the hospital, there's all the urgent care facilities around. Would there ever be, or one of your thoughts of maybe some urgent cares are for everything not related to this, and then urgent cares are specializing in this, or?
That absolutely could be a tactic that we take, and it probably depends on where we are at in the surge, the percentage of cases that are COVID versus not. I think it's going to be a dynamic and probably a day-to-day situation, but ultimately we want to minimize the contamination and try not to mix patients as best we can. So the hospital system has been doing a bunch of work around locating additional bed capacity inside their walls, and we're supporting them with some other possible locations as far as, so looking at things like how we can expand that capacity through urgent care, surgery centers, other locations that could potentially help with that surge. So those are all conversations that we're having. And then probably the kind of the newest, I shouldn't say the newest, but a lot of energy right now is going around supporting our vulnerable needs population. So or vulnerable populations, whether it's folks that are functional access needs, our homeless populations, and those with physical and intellectual disabilities. So working with the existing providers that provide services with those, seeing how we can expand their capability, particularly in light of increasingly restrictive circumstances for the community. Ultimately, our goal is to try to minimize their need to leave their home and we'll provide as many services as we can. And then also with our homeless population, obviously healthcare, they're already at risk from a healthcare perspective and hygiene issues, so seeing how we can support that. And we have folks assigned. We have Colleen Thomas now assigned to our team, working with both the City of Bend as well as Neighbor Impact and other service organizations to try to identify some solutions to meet those needs over the next month or two.
So when you're talking about we, is it all county staff that is the we, or is it all sheriff's department, or?
Well, I'm speaking specifically to the incident management team and the EOC that are working. Obviously we have we're communicating with all certain departments within the county as well as partner agencies.
So the other agencies are part of the we that you're talking about, and so you're the incident commander for that whole group.
And actually, we can provide an organogram if you want to.
We had one early on, but I don't remember if we.
I don't think it's changed substantially.
Yeah, we've added a lot of names. We have over 40 people assigned to our incident management team.
Yeah, maybe we can get that, Tom, and
I
at some point. I don't have any idea who's doing what, so.
So it's part of my job to try to provide and then to titrate strategic direction for this effort. And I think Sergeant Garibay made a very good point talking about the really important thing if we're going to have people shelter in place is we have to have the social and logistical infrastructure to support that. And the people that we're most concerned about are the people that we know are underserved and need help. So that includes the rate as of, I don't know if you've heard an update on this, but as of late last week, the children that are entitled to free breakfasts and lunches, I think the families were still having to pick them up from the schools, so some sort of accommodation so that those are delivered or somehow or other made more readily available, since some of those families may not have an automobile. The second thing is seniors that may have now taken our advice and been staying at home for weeks now. There are some markets that have set aside separate senior hours. I'm hoping they maintain social distance. I think that would pretty much require that those seniors have a car and be well enough to, and mobile enough. And then whether or not there's opportunities with that supply, and then the same question about pharmacies to either piggyback on the newly free capacity that caterers and restaurants may have. I don't know if there's emergency funds to help support that sort of linkage. And then the same issue about transportation of medicines from pharmacies. I don't think all pharmacies deliver. And then the people that are clearly circumstantially the most vulnerable and potentially people that could also be unwittingly spreading disease are people that are homeless. Telling people to shelter in place when they don't have a place is a real problem. We're probably around 1,000 homeless people or very badly underhoused people that don't have reliable places to sleep each night. Terrible hygienic problems. This is a disease which is very much transmitted by unhygienic conditions. It's transmitted in any droplet of, as far as we know, droplets of body fluids, especially sneezes, mucus, but it's also has a very long persistence in human feces. So people that are in settings where there's only informal or no sanitation, very clearly at risk, and then very clearly at risk of transmitting diseases to others. We have very high vacancy rates now, I assume, in our hotel and B&B settings. We can allocate any emergency funds to help house people. Doing that would require very good social supports. Some of these people would need a lot of support to be able to subsist in that sort of setting as well, and quite a bit of sort of assertive cleaning. But I mean, certainly the shut-ins, the people who have chronic disease, elderly, and the homeless are the clearest definable, very, very high-risk groups. And we're remiss if we don't attend to all of those with definitive social supports and do so quickly.
Couple ideas on this that I was just wondering if you thought. So you brought up last week about the children that are can still get food at school, and that's a big group. I have a son in high school, so I know about it. So why aren't they just picking kids up with a bus, just like they do during the school year? Why wouldn't they just this whole thing about kids not being able to get to school, now a lot of them can walk or ride or, I mean, kids figure out how to get to school every day normally. So why isn't that done? Has that been talked about with the school district?
I think those are some worthwhile conversations to have. We did have conversations actually this morning with our team, and we're gonna reach out to the schools about how to use those transportation routes and buses, not to pick up kids, but maybe to deliver needs. So we're having those conversations, and there's more to come on that. But
Yeah,
that
so,
is-
but I mean, this is a week later, and I'm bringing it up because I think about these things. I see the buses in my neighborhood, I know about them. I know, my son rode them for a year and a half. I know the kids that are at these schools, and so, then there's lots of people that could deliver food. I mean, there's lots of people that aren't doing anything. So I wonder, I hear a lot about the incident command teams and the organized people you've got, but there's this whole community out here that would willingly help with some of these problems. Who's organizing that, I guess is my question. So let me just finish that. So that's one idea I have that would be worth talking about. With regard to seniors, and they're the ones that are staying in house, which I think is lots of them. I mean, I hear about it from my wife who takes care of seniors. I see my neighbors, and I know what they're doing, and a lot of them. So again, is there a number to call other than a health line number? In other words, but they need food, or, geez, I'm out of such and such. So these things are community-based, they're not organization-based. And so that's a thought I've had for a week. I don't know who I share that with other than you guys, but.
No, and that's exactly the line of thinking that we're utilizing. Rather than reinventing the wheel, it's about coordinating existing organizations and community members that are already wanting to do stuff.
Good, yeah.
And because we don't have the staff to go do all these things.
Right.
So it's about how can we prop up those existing services and give them good guidance and support to continue to do the good work that they do when there's not a COVID-19 outbreak, but that how can we do that to enhance their capability in this time and so they can do it safely. And that's around what a lot of the work has been doing, just like you mentioned with the school buses. So how can we take advantage of existing systems rather than reinventing a wheel doesn't do a whole lot of good in this point. It's about how can we make the wheel better, and that's essentially what our teams are doing.
Sure, and one of the things the last 2 weeks we've been, I would say, exhausting ourselves and the opportunities to try to stand up testing rapidly. It became clear that we were only making limited progress on that. We're satisfied that many clinics and whatnot are able to do it. So the big subject we moved to this weekend is, because we were pressing with the health officers and the administrators around the state for the governor to make such an announcement and an order like we're now seeing today, and how we would support that. And one of the things we've had a lot of discussions about is whether we could bring a well-known business leader or a well-known interface with the business community, such as a foundation leader, a board, and set up a team to help coordinate community supports. One of the questions that I've had that I don't know why it's difficult to answer, but that I don't think we know yet, is whether or not any emergency funds are identifiable to help defer costs of all those different supply chains, and if so, whether or not private businesses, restaurants, caterers, et cetera, grocers could take some advantage, hopefully with some oversight of that or not, and it's not quite clear. So I wanted, before we start inviting large, and I did pitch this idea to the Rotary Bend, which is the largest of the local Rotary clubs, on Tuesday, and I heard some enthusiasm at the time, but nobody's reached back to me. I think it's a lot to ask recently shuttered or diminished businesses to just be volunteering, even, volunteering services, trying to make their payroll, trying to get people out there, trying to buy food. So it'd be much better to have clarity on whether or not there's any public funds that can be used in some sensible, metered, overseen fashion to take advantage of such synergies. And then also, I think that mobilizing the business community in some organized fashion would be very, very helpful. I haven't seen that grow organically. I haven't seen like the chamber or whatever do that organically. So now we're trying to figure out in the health and emergency response sector how we can help enable and promote that. I don't think it's our job to tell those people to do things at the private enterprises, but having something that we can organize and invite people to join. Does anybody know yet whether any emergency funds are available?
So, I just go down through the examples. So you start with the president calls them all in, The governor calls them all in. Well, that would be something we could do. We could call business leaders together. We're elected people. If we just knew you needed the help on something,
Well, I'm asking
that'd be
for-
something we could do. So, yeah, that would be something we could do as public officials. We could do that sort of thing.
That'd be very helpful.
Yeah. But,
Yeah,
and-
if I could just tack onto that, any support that the community can be, I'm a firm believer that, that the private enterprise and local community-based organizations oftentimes are very much more nimble than government. And so anything that they can do to take that burden off of us so that we can deliver those services to the most critically need, I think would be of assistance. And we do know that we do have, thankfully you approved us some funds last week. Oh, when we were here, is that better?
Yes.
You did approve us to
Yeah.
utilize funds, and I think in certain circumstances, we can utilize those funds to support critical needs of our vulnerable populations. And we're having those conversations as we speak right now with community organizations.
Just to be clear, though, when I was talking about emergency funds, we're very grateful for the funds that you approved last week, local aid, and those will help quite a bit with us. But the costs of coordinating and delivering and organizing a food infrastructure is far beyond sort of the usual ability and province of local government. So I was actually asking about the federal, state funds, and then
Well,
the SBA inducements. That's all.
Yeah, well, follow the news. The federal government's going to spend trillions of dollars, and so I assume some of that's going to get here. Are you asking us to figure out how it gets here? We could do that. Well, the other thing is the state, I think, is going to have money. I will bet they come up with some money. But yeah, if you read the bills and if they get this third one out that they're trying to do today, that's held up over a partisanship, basically. I think that's true. Are you asking us? Would that be something we could look into, or?
Would be very helpful
But-
measures. And
But
in order
just so you know, I think there's lots of people in this community that are in nonprofit organizations that have massive databases, as well as businesses that would do things to help right now if they were asked to do things. They're not waiting for federal funding. They're not waiting for state funding. They have a car full of gas. They could deliver meals today. There's really,
nothing inhibiting
so,
them
yeah.
from doing that
Yeah.
at all. However, if
Except they don't know what to do, so nobody knows what to do.
I know that Shepherd's House is actually doing, you can either drive in, drop off a box of food, if you're in that position, or you can drive in and pick up a box of food. So I know they did that testing last Thursday. They're trying to maybe move it right across the street, so it's an easier in and out. They're working with their neighbors on that, but that's like a great program. And yet, you're right. We've got all these empty school buses. The schools know the children that, are, given the food. So isn't there someone in that system that could actually drop off the food at least, and then on Friday, drop off a bigger box for the weekend? Because I believe they were given food for the weekend too. It's like the food for their whole family.
So the concern that I'm voicing at the level of the health and emergency management is doing our best to help encourage and to assure infrastructure and logistics that are of appropriate scale to meet the needs of this fairly large and expanding group of people with such needs. So I think it's great. Any businesses, enterprises, NGOs, and maybe you want to talk a little bit about the Red Cross and what they're
Well,
doing.
we have a really good relationship with the NGOs, and we're coordinating with them. In fact, we expanded our health and human services component in our team the last couple days to specifically reach out and coordinate with them and see how we can support what they're already doing. I think that's probably our best strategy at this point. is the supporting the agencies and organizations that are already delivering services to these people. And so we're having those conversations. What do you need? How can we support, whether it's financially, logistically, guidance, and those are the things we're working on this very minute.
Sure, so.
And the other thing we should comment on at this moment is the fact that our blood levels are so low, and people need to go, if they can donate blood, please go do that, because the levels are, we're down to the very bottom.
So one of the programs that would be a very logical thing to expand is Meals on Wheels, which is coordinated by Central Oregon Council on Aging.
Yes.
But there's a couple constraints. One is that my understanding is that the meals are delivered, or basically all that there's the food, whatever the infrastructure is for providing that. But the other thing is that many of the people, I know this from my own family, many of the people that have been doing those deliveries are elderly. So if we're going to ask elderly people to go out and see other elderly people, we have to be very, very sure that there's adequate precautions and they have adequate training for doing it. And I don't know if there's a cadre of additional people that would just volunteer to do that services, typically with their own automobiles. So just to be clear, I don't think, maybe Sergeant Garibay feels differently, but I personally we're not trying to express any sense of ownership, domain, or agency over things like the grocery supply chain, pharmacies, and everything like that. We are pointing out that that's a pressing need, and anything that you can do as elected officials, anything you can do based on relationships that you have, I'm a relative newcomer, but with the business community and whatnot, and with the NGO community, would be very, very helpful. And what we would do is try to provide the technical tools of measurement, information gathering, and as we ask people to self-quarantine with their families, as we ask other things, we can help with the underlying locale of the people that need that service. So I think we certainly don't mean to imply any level of inhibition or intended oversight in this, but we are offering coordination and we are offering support for such efforts. You want to expand?
Nathan, have you talked to Meals on Wheels, son? Have you talked to them?
We have reached out to Central Oregon Council on Aging. That's what they're doing.
Right.
The team is doing, yeah. And we have a number of, we are reaching out to known people on registries, including those that are on their registry, to check to see what their status is and if they need any support. So we're doing that from the EOC as well.
So have you heard back?
Yeah, we only had one person needed assistance and they wanted help painting their house. We said we couldn't help with that this month. But so far the
need
rest
is-
are doing okay.
Oh, okay, well, if we can help them.
Absolutely. I think as in the next 24 hours, we should have a better sense of, probably it will be maybe some financial contributions that county can just to support what they're already doing. And I think we'll know that in the next 24 hours. And within that $500,000 that you all approved last week, we have some room to do that currently. So we'll see what the need is, and obviously if it is much higher than we anticipate, we can always come back and have some conversations. But within that $500,000, we did include support for vulnerable populations, and so we're prepared to execute based on the guidance that we received last week.
So I think I'm sorry.
Oh, I was just going to say, a lot of people in the service industry lost their job last week. So definitely there have to be people in our community that would take this job if they could, safely, and, deliver food to people that need help. So, and not have vulnerable people delivering food.
So,
I'm sorry. Go ahead.
just, let's acknowledge that, friends and families, faith-based communities, there's a lot of networks that are out there already. We're looking for that next step of vulnerable people that have either chosen to or don't have those connections. So, the definition of who we're trying to serve. It's not just everybody. There's a lot of people that are going to be able to have, the families, the family unit, people that have chosen not to be part of the family unit, which end up making bad choices and becoming homeless. maybe there's a way to backtrack on some of that too. So there's a lot of things that could be moving right now too. We absolutely want to help the most vulnerable out there. In the scope of things, last week is the reality of social distancing and talking about shutting down some businesses possibly. Just a couple hours ago is when it really got put on paper, that executive order. So I'm trying to work through the agenda here a little bit. The governor's stay-at-home order is in place right now. So this week, there's the reality of, this is going to be a little bit longer, and you can see it. Some people are right on it. You hear directly from the health director, we need to do this now. Folks that are working in the medical world, we need to do this now. Other people are like, it looks like something bad's coming. Other people aren't listening. So it's propagating through our community right now. So this week, it's Monday, we need to start working through what is this going to look like if it's going to be a little bit longer. Next week may be the time when people are really calling, I ran out of something, so that's where we need to start planning for. Chambers of Commerce are ready to go. People are just fidgeting, trying to figure out what are we going to do, what can we do for our friends and family. I got a situation where I need to call about 3 people, the people across the street and down the street that I wave at them, I say hi to them all the time, but I should have a better connection with my neighbors, the ones that are walking distance to my house. So you can do that. Let's get to each other's phone number, make that relationship, and understand what's going on. The day you need to, I wish I could make this recipe. I wish I had a cup of sugar. That relationship's going to be pretty valuable. So I'm just putting a perspective around all this.
So I think that as we move toward, and I agree with everything you said, our most elderly neighbors, we've been reaching out to every day or two, make sure they're okay. They're in their 80s. We know them fairly well. So the difficult, and I think shared frustrating experience the last few weeks is that we've been trying to push on a rope. So the testing and the swabs and everything, unless we're very, very fortunate or somebody is more artful at this than the bunch of professional people we have already trying, what's probably going to happen is we're going to get those things when we get them, whenever somebody works out the supply chain, and heaven knows how long that's going to be, maybe another week or two. Until then, though, now that we have this coherent, shared national and local strategy of doing everything possible to separate people, not emotionally, but to separate them, and hopefully social media will help them stay connected, and families to shelter in place, individuals that aren't in family to shelter in place, everything we can do now as quickly as possible to set up all the social and logistical supports for those who need it. Among those people would be, the people that had their carts overflowing at Costco probably aren't the people I'm talking about. It's the people that can't get there or don't have the means, whatever. And organizing as quickly as possible, and then once again, setting a very clear priority on the most vulnerable and dealing with them, and setting aside any sort of judgment of how people ended up in a circumstance, realizing that to the extent that we don't help the most vulnerable people, then that may inhibit our ability to contain the transmission of the disease.
Well, and as I say, situations like there's a husband and a wife maybe retired in the home, and come to find out they're, the mother-in-law or the next elderly generation is there, then you don't see that person. We just make sure you have those relationships around you. Supporting Meals on Wheels, that homebound person that expects or has experience with a little bit of interaction. There's folks that maybe find their life's calling in doing Meals on Wheels right now. So let's make that offer to folks. The Council on Aging, they've got needs, and we can sure help with that. So we're going to get down to specific requests and asks and financial needs. Incident Command is a great way to coordinate that message. When anything comes up in there, we can make a decisive question and answer about that. As I say, I'm interested in talking about this stay-at-home order and how we're going to implement. How can somebody really figure out a decision matrix about, do I open the doors to my business? Do I need to think of a 1 week, 2 weeks, or a month, or 6 weeks, or whatever it's going to be, closure? How am I going to pay for my rent? What do I do with my employees? And I need to know more about that right now. So can we step to the governor's order?
So actually, if I could just add, where I was going with the other thing is that, until now, the things we've been talking about most are clearly in our domains of health and emergency
Yeah.
preparedness. However, things like encouraging businesses to get things done and whatnot is much more likely, actually, in your frame of expertise
yeah.
and influence than ours. So we're not presuming at all to enter into that, and we would greatly appreciate other hands trying to figure, so we can continue to focus on dealing with potentially a real medical crisis and societal crisis. The one thing that I didn't mention, and I think we should point out, is that many of our behavioral health practitioners, and we have hundreds of them, have been dissuading clients that didn't need to be seen to either stretch out their appointments or be seen by telemedicine, be contacted by telemedicine. What we're trying to do is set up a cadre of them to serve as, one of the terms I've heard is trusted messengers, but allies, to do daily touch bases with people that are asked to stay in the home, elderly, people that might already be clients of ours. And that's one of the things that can support and provide granular information into this logistical process of supply of food and making sure that if somebody is getting very ill, that they get to see a doctor. There may not be enough ambulances to do that. Some ambulance crews may end up being at rest because they've been contaminated in caring for someone. So we're getting into a domain now that's more logically the province of business, the public sphere, elected officials. So we're happy to hold your coats and try to help with that, but it's clearly not the area that we're most expertise in.
Well, and we're struggling, I mean, I am, trying to figure, okay, what can we do right now? Where can we be partners in this? Incident command is going to be one step into, the management of the public health crisis. I think the Chambers of Commerce and our EDCO and the manufacturing companies, right now, we need to learn about who is closed, who can keep going. I envision those manufacturing companies that are, that have a supply chain and a customer base, changing their shifts around, making sure there's that social distancing, doing whatever they can to, maybe slow down production, but keep something going there on that business. And that is where we can plug in with the relationships in the business community.
I did want to check with you, Nathan. According to Dr. Kinney, she has ordered Thermo Fisher Scientific. That's where she placed a huge order. And there are 8 different types of testing kits that she has designated that she would like to have for COVID-19. So I know we had a huge ask on the list that we approved. Did you also order from that company?
I'll have to check with Sarah where we ordered. I know
Okay.
we're back ordered.
Okay, well, you know what, we could start calling. It never hurts to call and say, okay, she's saying 6 weeks out. So,
That's what Dr. Kinney's saying?
yes.
Yeah, I think that's
what we're hearing.
That's what we're getting to.
So-
I messaged Sarah while we were in the meeting, and she indicated that they're in back order, but she was going to call and find out.
Okay, so let's find out if we're all working. It's the U.S. company. I think they're in Boston. So let's see if we can talk to them.
So I think the 2 areas we can that I'm really going to focus on is business and legislative, like this
Yes.
one, talking to Senator Finley. That's where he's going to be valuable, and we saw this in the short session, valuable to give them feedback, specifics on the ground from our county, because when they're sitting in the committees over there in Salem, that's where they need the talking points and the facts as we know them.
I think anything that you all can encourage and help organize to help people feel comfortable and safe in their homes and they have the basic human needs, you will all be practicing good public health by doing that, because right now that's the best we can do.
So along that lines, I guess one of the questions as a elected person that I kind of deal with is, I had these thoughts about getting the food out from the schools a week ago, but I don't run the schools. I don't run the bus lines. I don't know who does. So I assume the people that run the schools would be thinking about this. And if you need us to call some of those people to find out if they are or not, we can do that. But I mean, I don't immediately call up the superintendent and say, well, what about why don't you run your bus routes and have 2 adults or 2 seniors in high school sit on the bus and deliver those homes because, or,
We
so,
actually have
so,
that set up.
so maybe you've done that, but I thought about that a week ago and we could have done it a week ago.
Set up-
So,
Set up what we call an executive council of all the senior.
well, I'm on it.
All- right.
I know, we're on that call.
So
I didn't hear one discussion about that.
I didn't hear that question being asked. That would because we do have the superintendent.
Well, I know, but why doesn't the superintendent think of that? I mean, or has he thought, I mean, am I supposed to, I could go through every one of your problems, I could go through that way, like the homeless part. Well, we've got people in Central Oregon Veterans Outreach that's knows where a lot of homeless people, do they need additional volunteers? Do they need 5 or do they need 10? What, do they have to have masks, gloves, what do they want them to do? Okay, but you're saying you're doing it, but I'm saying,
We've already made.
oh, good, well, you've solved it. Then why, the point is, that we know these same people, and so I haven't heard that being done, but we heard the need for it. But again, do you need volunteers in the public to help you? I mean, I'm sure there's people who do it.
Any of the things you're suggesting, Ms. Hirschman, who works for me, can push those questions and describe the opportunities and the needs. We can do that in real time today to those groups. I mean, we're meeting telephonically once a week. The door is open to have a special meeting about this. I think those are very good questions to ask of the school district. I've been asking them, and I understood that we have a conversation about that, but it certainly doesn't hurt to ask that again. Nathan?
Yes, I mean, every time I come to the meeting, I take notes, and my intent is to go back and make sure we're doing those things, because I think you have great ideas related to, and I don't want to get into the technicalities, but the very conversation we're having today is utilizing the bus routes and essentially kind of like a team concept of different entities that have services to provide to be able to, capitalize on those. So that's what they're working on now, putting those kind of things into place. But again, having an idea, and I'm a great idea guy too, but having an idea can take 2 or 3 or 4 days to actually implement, because you have to get people at the table and figure out the legalities and the risk management component and the funding and all these things. So that's what and unfortunately we never are as efficient as we want to be. I used to joke when I was a real cop and we'd write a search warrant. The joke was, if somebody tells you how long it's going to take to write a search warrant, you add 3 hours and you double it, because it seems like it's only going to take us a couple hours to do something that takes a lot longer. And I think we're running into that.
Look at that. I guess then as you design these strategies, the thing we could help with maybe is if you need people to volunteer. So for instance, one thing you mentioned about the bus routes, well, and things like money, they would be running the buses every day if school was in session. So they have the gas money. They would be paying these bills anyways for the school system. So I guess I'm not sure why they don't have money to do that. I would, there's plenty of high school juniors and seniors that are out that are very responsible, and I'm sure each school could come up with a leadership list of kids to do the delivering if you don't want seniors or adults to do it. I mean, so I don't know if you have a committee on food distribution, but those would be, but if you want us to help solicit people and you don't want to do it with all the staff, then we need to know that, and we could do that.
Yeah, I think we're not quite at that point of soliciting help yet. But again, it's about getting the right partners to solve the problem, and then solve the problem, then to determine what the resources need to do it. So I think we're very close, but we may not need volunteer assistance to do those, because the existing programs might be sufficient. It's just about streamlining those processes to get those services to people that would otherwise not need them. So.
Could I go over to the homeless, Nathan? Okay, so Colleen runs our program for the county, but we're talking 1,000 people probably in Deschutes. And then we're talking about, Kova, JW, Terry, and Kathy, who I'm sure are working night and day. Now, do they need some help from the county? Have you talked to them? Should we talk to them and see? I felt like when I stopped there a couple of weeks ago that they probably need some help.
They probably do. And, they're meeting, they were having a conference call when I was leaving to come to this meeting with the providers to assess their needs. And when I get back, we'll check with Colleen and Chris Weiler, who's running that portion of the team. and determine what their needs are. We had the discussion related to what kind of support we could provide, and so hopefully when I get back from here, there'll be some tangible needs that we can address.
Sure, and if we identify any additional wherewithal to do these things, Colleen is the interface between our services within the county, and then she's also co-chairing the Homeless Leadership Council, which consists of many local NGOs and charitable and other organizations. So it's very easy to propagate that information, and unless people to do work, it would be helpful if we were aware of some resources that might be able to be available to.
We've already
We know
authorized some
We
resources.
resources, yes.
Yeah, I think once we get that nailed down, I think we'll work with the JIC to put out the call and where people can go to volunteer and what is needed, and I think we can solve that.
Well, actually, I'm sorry, that what I'm referring to is, once again, of an appropriate scale, and I don't know that we have the resources to do this at scale.
We don't, to be honest, we don't know what scale you're asking for.
Right.
So when we know that, we'll talk about, and we'll find out but I've got memos in here from, Senator Wyden, Senator Merkley. They have people, they're talking about how much money they're getting everybody. We can get a hold of them, but we don't even know what needs there are, so.
If there's housing available because of vacancies, and you want to try to house, say, 500 of the available 1,000, I would assume the costs in that would be somewhere between $50 to $100 a day per person plus feeding them. So it's very substantial cost. So that would be of scale and probably not within one or two orders of magnitude of the funds.
From what I've gathered, I don't know if you're talking about the homeless population, or you're talking about housing
Yes.
them. So what I've gathered from all the meetings we've had on that is a lot of the homeless people.
It must be programmed to end this conversation.
I think we wore out the
There you go.
patience
Done.
gizmo there.
Yeah, it's done.
So I'm
I
not
guess
saying.
we'll just have to check and see how many people we're trying to house. But one of the reasons they're homeless is that they have one way or another decided they want to live where they're living. People aren't being forced by someone telling them to do this. They're doing it. You see it all around the community. But if you offer everybody a housing, what J.W. Terry would say, and I've heard him say it at meetings, is they're not all looking for a spot today. So I guess if you have a need, then we could talk about what the need is. But I don't think we're going to solve this problem by doing that. That's my impression.
Many people, when they're offered vouchers, do take them for temporary housing. It would be beyond my knowledge to estimate that. I was actually just citing an example of something that, if we want to do that at scale, we need to figure out what we can do before we start offering it.
And
Well-
I can say that we are prioritizing those that either have significant health problems, elderly. There's a mechanism in place to prioritize those that we need to support immediately versus those that we can find some alternate resources.
The fact that our warming shelter was full every night at 48 does tell you that they were using what was available. So,
Overnight, but where's the other 950 that night? So
Right.
I don't think, I never heard that we had,
Oh, but there were
50 more showing up there. So we don't really know how many people avail themselves of what. I guess that's all I'm saying.
well, that was Bend, but there were housing in Sisters and in Redmond.
So what
There's
is the
housing.
Total 100 beds?
You know what? I don't know. Jericho House? I don't know. I guess I'd have to ask everyone.
Yeah,
Find out.
I'm certainly not an expert on that, and that's why we brought in folks that are experts like Colleen to help us make sure that we're doing right by all of our populations.
Well, and the other thing is, we could titrate such expenditures based on the willingness of people to be, I don't know. It's a good question, how many want it and how many would refuse it. That's, titrating to that availability is maybe the best we can do, but this is just, I'm only perseverating on that particular thing because that's the most clearly definable high-risk population, both for their own risk, but the risk to others because of hygiene. They're the most hygienically challenged definable population.
Okay. We do need to implement a discussion regarding the governor's stay-at-home order, essential services, and our county buildings. So,
Yeah, Commissioner, so I think you all have a copy of the order that was issued this morning. Sorry. And,
Tom, do you want to identify yourself?
oh, sorry.
I don't know, are we still on?
Right,
Okay.
I'm Tom Anderson, County Administrator. So the governor issued a order this morning. We've had a chance, it came just as the meeting was starting, so we've tried to kind of parse through it as we've been conducting the meeting this morning. It appears that it applies to a whole new cast of private sector businesses that are actually itemized in the body of the order. I suspect that many of them have already closed, you know, ones that are gathering spots for various activities. So in terms of how that plays out, enforcement will be primarily up to law enforcement within our county and statewide to enforce. I'm guessing through education first. In terms of what this means to our county government, which is kind of my focus on this, although we can speak to what's in this order to whatever level the board would like in terms of county government. Essential versus non-essential county services is certainly a key theme in the governor's order. Each of our departments have already, have previously during other emergency types events like the snow events that we've had here the last few years, but have done their own assessments on what they believe is essential and non-essential. We talked about that last week with the department heads. I sent out another note this morning to the departments alerting them that we were going to have an order from the state this morning and that we would see what it says, but that following the receipt of that order and the discussion with the board today that I would send out a more formal request to each of the departments to submit to administration and to the board their assessment on what of their services are essential versus non-essential. And so we should have that, I hope, by close of business today by department. So for the ones, obviously, that are essential, they will continue to provide the critical services that they need to within our county government. The ones that may be non-essential, the governor's order does not basically order that work to stop. It basically directs that can't be done within county businesses. So there may be some aspects of work being done within departments by what might be considered non-essential employees. That's still important work that could be done remotely, that they could do through a work from home type structure. So those questions are being worked through. There is also a certain amount of work that, at least for now, may not be able to be done by, in other words, a non-essential part of a department's service array by certain employees who aren't able to work from home to continue to do that. In those situations, an employee can take paid leave, or we are also coordinating a clearinghouse of work that still needs to be done that could be done by employees in a department where there's nothing that they can do under this period of closure. So we're trying to link up those two things, both departments that need work done and departments that may have employees who could do it. So that's kind of where we are in terms of essential. The other question along with this, and we've talked about this before, is the status of county buildings. The governor's order seems to imply that all government buildings should be closed to the public. She's ordered that for state government buildings, and I think strongly encouraged is the word in the order for local government to follow suit. So as of now, as you know, our buildings are still open for walk-in business, although we have done our best to promote to the public online services and phone services that could be done, which we would continue to do. But again, I'm offering that up as a discussion for the board this morning on whether we continue to do what we're doing or if we take that next step in terms of closing our buildings to essentially walk-in traffic and limit it to phone, internet, and appointment-only type services. So I'll stop there. That's kind of my assessment of the order and what it means to us in terms of our services.
I thought last week that that's what we determined, that we would be locking our buildings. Only if you set up an appointment, you'd call when you get here, we'd have a notification on our door. Wasn't that part of what we came up with last Wednesday afternoon, wasn't that meeting?
I don't think we went that far.
Yeah, I didn't hear that. We encourage departments to take a look at their services, and in some cases, some of that, at least for part of the day, may have happened, but I didn't hear a blanket closure of county buildings.
Yeah, I think you're wrong. I think what Tom's saying is correct. We had said, look at certain departments, but there's certain ones like the clerk's office, we'd said, we'll just try to move it away from which they've done, and then we've got the tax paying, we thought we were gonna keep that open. We talked about CDD staying open, at least as of last week. I think it's a new discussion today, whether we do all those things, but I think we're doing what we decided as a group.
Okay, well, I thought there was another step if we had to, so.
Well, there is,
Right,
that's what we're
so
talking
that's
about
the
today.
step that we have to do.
I was just wondering, do we really need Director Conway or Nathan to continue to be here? It doesn't, I look at the agenda, there's not really any more that's really involved, and I know judging from their phone activity, they have other things they could be doing.
Yes.
No, I know.
They left 10 minutes ago.
I know.
So actually, I do have a question, because I really very quickly read the copy of the governor's declaration that Sergeant Garrity shared with me coming in this meeting. Do we know for county buildings, so the ones that we provide services in and that we're co-located with an FQHC, for example, are those supposed to be immediately closed as well, or is that based on the judgment of what services we may need to still provide in situ?
Well, that's what we're having the discussion about. That's what I've asked departments to look at. That may be a different question for health, which we should probably talk about specifically.
So we don't know from the wording then whether it specifically.
Wording doesn't define that specifically.
I see, okay.
Yeah, and we can talk later on.
Sure,
So
sure, that's fine.
Yeah, I'm sure you're busy. I'm sure you've got other stuff to do, so I think we can take off with the rest of the
Thank you
agenda.
very much. Thanks for your convening these frequently and being willing to lean forward on, many of them we're really talking more now about societal things.
And if you could just give us the status of the 10 current positive people in our county.
On my list.
Thank you very much. I think that would be insightful for the residents in Deschutes.
Will do. Thank you.
Thank you.
Thank you very much. Well, so I do support generally the concept of being open for business. If we close the front doors and put a sign on it that says, call this number to get service, that's fine. If we're taking that step, it is very quiet. We've been here for 2 hours or so, and we've probably seen about 5 cars. But there are people walking in the front door still at this facility downtown. Permits, if there's I talked to an electrical contractor. He said that, if I can have the house, if he's residential, if I can have a house one afternoon all by myself, I can do my work, and he's there by himself. So I think there's economic activity that can happen, and, decisions can be made by our departments for, whatever, all the services we provide, with a clear posting that says, call this number if you need to do business with us.
Well, so I went to the post office today. It's open. And I was surprised the 2 women that were working there didn't have masks or anything. They didn't have gloves on. I was surprised. And my wife's all over me to wear those things. So they're open. I went to the landfill today. It's open. I don't know whether it's, that's a discussion we'll have. But I'm just wondering if there's certain things that we don't need to close. It doesn't look like the order refers to local government buildings, there's a big, it does say all state buildings, unless you can point me to.
14, down below there, it says, refers to local government, says, although they're not ordering, they're strongly encouraged, all the things that are listed in 12 and 13 up above.
Well, strongly encouraged, but it's in their interest to, they have a different interest than we do in a sense. I mean, they don't probably even know what some of our local government, so to me, we should walk through by department. Are you expecting some further thought by your departments today or tomorrow, or do you have everything we're gonna get today already?
I don't have it yet, it's been coming in, but the challenge is that it's not necessarily all or nothing with departments. In other words, there may be certain aspects of a department that are essential and others that aren't. The sheriff's office, for example, is probably all essential. 911, there may be
Yeah, but see,
certain
the
pieces.
sheriff's office is closed to that. They're not meeting people in their, he's made that decision. You can't go in their lobby.
No, I two different things. One is a closure of buildings, the other is
Oh, I was talking
essential service.
Well, I was talking about close buildings.
But
Services, I think, will take more refinement than spaces. I mean, I would think. I mean, I don't know exactly why we'd close. Give me an example of a service that you think we would close because it's not essential.
Well, and again, perhaps I chose the wrong word. I don't know that we'd necessarily close a service, but we'd close a building related to a non-essential piece of business. For example, in community development, which is one that I'm a little bit more familiar with, you've got code enforcement, building inspection, septic inspections. All those would, I think, be clearly considered essential services. You've got, say, long-range planning, while an incredibly important aspect of what they do isn't necessarily an essential service in terms of public health and safety. So that work, while it could be done remotely, certainly, it would be an example of why the building wouldn't necessarily need to be open to provide that service. There may be other, within our the departments within this building upstairs where people still need to, say, pay bills, but they could do that, remotely or online, but we wouldn't necessarily.
But if they're spaced out in different offices or, 10 feet down the hall from somebody or whatever, I guess I'm not sure what the risk really is of people working in that sense. I get why you're closing barber shops or day spas or whatever because of the human-to-human contact, but if people are just doing their job in their cubicle, is there a concern that the germs are going to just spread that way, or?
Well, I'm not a public health expert, but I think the theme of the order is to limit travel. So if we're closed to the public, then people, that's one fewer trip that someone might take to come to our building and would, as an alternative, try and.
No, I get that, but I mean, there's a lot of people that don't talk to that many people each day. They talk to the other county people. So, I followed what you're saying about CDD, but I wouldn't want to lay off our long-term planning over this. I'm fine if they work at home or, Nick and you figure out who should stay there, or they work in some other building, or they alternate their shifts, or, if we're just trying to de-densify buildings like we do these rooms, I think that's good, but I don't understand why I think all of that stuff's essential in a way.
And I probably explained it badly. If I could.
No, you didn't. I think you explained it very well. I'm not saying, but that's, are you saying you think we should go beyond what makes kind of business sense that way? I don't feel that compelled to follow the governor's order. I guess it's just me. I don't feel that compelled to follow it on going through and deciding every one of our employees whether they're essential or not. Do legal. Do we
You're
need
already
all?
staying home.
Well, the moment we ask somebody not to come in because of whatever reason, that's where we're crossing that next line, saying we don't need your services, and are we gonna pay them for not working, or, I don't know that we're going there right now.
I see the essential issue a little differently. I mean, the way I understand the governor's order, and I'll use legal as an example, we are able to do quite a bit of what we do remotely now. We've made efforts to do that. But certain times, we need to be in the building. And for instance, we have a civil commitment hearing coming up in a day or two. We've got to be in the building to get medical records, to coordinate witnesses. We're going to actually be in the courthouse to actually try the hearing. In that instance, that staff or person or two would be essential. But when that hearing goes away, I don't know that they're essential for travel purposes. I think they're still essential for operations of the county, and that's why I have them set up remotely. But I think to comply with the governor's order with regard to, unless you're essential, don't be out traveling to work, I'd have a hard time saying they're essential to where they need to be in the bill. I don't plan to be here Wednesday if you have a meeting, because I don't know that my presence in this room is essential if we can figure out a way to network in through the phone or the video or whatever that I'm told Joe and Whitney are working on as we speak, so we don't have
So
this
it's better.
situation. Yeah. So, I mean, I think, as I read it, the essential piece is limited to, they don't want you out traveling to go to work unless you're an essential employee in a business that's allowed to be open. And so,
Is it-
Yeah, I don't know, I don't think it's, see, I don't understand the focus to be, they don't want you driving. It's what you do after you get out of your vehicle
well, right,
that they're worried about.
right, then you're out and
It's
about
not
amongst
that you're-
people, touching door handles, going to the common bathrooms, doing all the stuff that is gonna bring about that spread, arguably.
But that's where I'm saying, so your point, or so you're saying that everybody in your department's essential, but their day-to-day functions differ? Is that what that some things are doing mean they have to come to the office to do them, and some things don't? But you're not planning to lay off 3 lawyers for a week
No,
at
we
a
have plenty of
time, or-
workload to keep them busy
Okay.
remotely, but I'm asking that they only come to the office if there's an essential need to be here, such as a civil commitment hearing that they have to be
Yeah.
at the courthouse for.
So, and
How's
again,
that
I didn't.
square with what you're saying?
No, I think we're on the same page. Again, I didn't articulate it as well as I could have. And the example of CDD is long-range planning an essential service for which the building would need to remain open? Probably not. Is
In
it
the lobby or just?
the building, the lobby? Yeah, to allow people.
I mean, there's 2 parts. One is public access, and then but the building to me is where they have their desks or their offices.
Right.
So are you
They-
saying both or one?
Like the lawyers, they could do their work from home, and they wouldn't need to travel in, and the public wouldn't need to interact with them. The rest of CDD, it's essential service, they probably need to report either to work or to the field to perform a building inspection or a septic inspection. I happen to know that they are deploying remotely. They're able to provide inspections to inspectors so they're not coming into the building, they're going straight to the field.
Okay,
But-
like code enforcement, you're saying that the information it'll be disseminated from the office then?
There is a means, code enforcement I would consider an essential service. There is a means for that business to be conducted, however, without the building being open. They are still, can accept phone calls, emails, other means of reporting a violation that they can then deploy to, so.
See, I don't think it's a long discussion about what the front desk is open for. You can decide whether any of them need to be done. But to me, like, my impression of long-term planning is different than what lawyers do. It seems to me long-term planners do a lot of talking to each other. Now, maybe they can all sit at home and Peter can talk to whoever the next long-range planner is he wants to over the phone, but don't they all kind of collaborate a lot? Which is not the same with lawyers. Lawyers have their caseload, they talk to Dave, but they're not all chit-chatting between them. Adam's not checking in with,
Amy.
with Amy about his land use deals unless it's, so I don't know. I guess I'm just saying, don't most of those people still need to go to work over there to really be the most effective?
In a perfect world, they probably are optimally effective if they're together, but to provide adequate service for an interim period, there are means for them to communicate which aren't necessarily face-to-face, whether that's email or
Well,
phone or text or group
See, I'm good if you do that, but I wouldn't, I spent, I just don't know. I mean, if it's just calling another guy or woman and saying, hey, what do you think about this issue we're working on? What are your thoughts? Here, I'll do up a memo, and then you look at it. It's one thing. If we're inventing all these things like these virtual meetings, and I think that's a lot of work, and it's not paying off completely. I just think unless they don't want to be at work because they're afraid, but I do think you run into other issues about, are you getting your full time out of people? And my other concern, moving to a different department, is places like the health department where we have, I don't know, 70 or 80 behavioral health specialists. I will bet you that some of the people and a lot of them do counseling type work, therapy type work. I'll bet some of those people are not going to be going to those appointments. So the main work of some of those employees of ours, some of them is therapy, counseling things. So do they keep showing up there to do that, or what do they do with their time? Because they're hired really to do that. So that's a different variable kind of thing. Is everybody essential, or does the health department say, well, we're going to have to, do something temporarily decrease that service because we're not using it as much?
But
I mean, that's
would
the
those
kind of-
people go over to public health, though, and help them in this time where you have to do all the tracking for the
Well,
different,
good. But if somebody has that imagination and
Well, I would hope that they would,
that.
because there's a lot of tracking that has to be done, and,
some of
they
the
would
things
be
we
like,
discussed today,
they would be
yeah.
like the automatic people to be pulled in, they are from the health department, and it's amazing. But I do think, like, our passport department, because the state has not issued driver's licenses for people that are facing an emergency and need to get their passport, we need to provide that service with appointments.
Well, a couple things in there. I happen to know that the health department has, they're doing as much remote work as they can. They've been on that mode for a couple of weeks now. But whether, and again, I've asked each department to do their own assessment on how they intend to continue essential service, what they define as essential service. So that's coming, and I hesitate to speak too much about precisely how the behavioral health intends to continue service and how they can. I know they are doing some remote work in terms of counseling, interacting with clients where they can. In terms of the clerk's office, it is an elected official, so I don't necessarily have the authority to dictate how Nancy provides service, but I know, as you noted, they have adjusted so far in terms of their interactions, whether there's a way that they could provide, say, passport services if this building was closed to walk-in traffic by appointment, to be able to deliver a finished passport, or however exactly that service might operate. I will have to defer to Nancy to see if that's possible or not, but that's what they've been warned that we're going to do, and as soon as we're done here, I'll put out the formal request that each department provide that analysis. And I imagine many of them are watching this now, and
Don't forget marriage licenses.
Right.
Because I had a call last week that was,
registering to vote. I mean, there's
Right.
things that are basic citizen deals that they do. But I guess we could talk to Nancy and see what she's thinking. I mean, I haven't talked to her. I mean, it's her, like you said, it's her department in terms of being she's the clerk. To me, if I go to the post office and there's somebody there taking my mail and giving me stamps or whatever, that's kind of like what I see our clerk's office doing.
Well, we heard this morning on the phone call that the clerks by state law are required to be open for a certain amount of hours also. So, and they were asking for those rules to be relaxed possibly. So it'd be interesting to know that information.
That's
You know,
in one of the proposed emergency bills I know
Yeah.
that AOC is working on, is to relax those clerk
Is it
hours.
like 40 hours? I mean, they're required to have the doors open at the clerk's office by law.
In one of the emergency
Yeah.
bills, I know that the language that they are pushing forward. I don't know what'll become of it, but
well, I would say that is, their services are
Oh, yeah.
essential.
So like CDD, I would think that for the building industry, you'd still want to be able to receive plans. I don't think everybody's geared up to do it through email, and sometimes people want to talk about something. I don't know if there's a way to do it, again, at a distance, where you're saying, there's 4 things I've got on these plans I want to look at. And I mean, it's hard to do all business by phone or email. I mean, it's very I don't know, phone's easier than email, because email, it's hard to, you can't react to what the other person's saying, so it's this long, drawn-out thing, so, I don't know about, I mean, you could have a sign in the front lobby that says we're not taking, like code enforcement complaints in person, here's the number to call, they can do that, or, whatever, I don't know how you break down what goes on there, I don't know that you have to meet with long-range planners for the next 2 weeks in person. Here's the number to call for that. I guess that would be what, a developer comes in and wants to talk about a plan they're working on and has some questions. Is that what long-range planning might do?
Long-range planning is probably more meeting with, other agencies, with the state, with consultants.
Okay,
Yeah,
so-
I don't think there's many walk-up customers.
What do you call before the group that does what I said? Comes in, they want to do development. They want
Oh,
what these-
that's current planning.
Okay.
All right.
So current planning may be able to set appointments or something like that. You could have seems like you could have a sign that said these things. And long-range planning is probably, they do it by, if it's other agencies, they don't probably do it very much anyway. But I think you don't want to be in like, another thing I know when you're building, when you got somebody that wants a lot, there's a lot of times we'd meet with Todd Cleveland about water, septic issues. So that's a front-end question for people a lot of times, or for the family, or the, what's it called, the zones, the wildlife zone, or the, along the river, you have to find out if you're on,
Riparian.
well, yeah, stuff like that. But you'll meet with Todd or somebody to go over, does this work for this house? So those are hard to do over the phone, maybe, or maybe not. I mean, I don't know, I just think each department comes up with its recommendations, don't you think?
So you're saying that you should get those recommendations from each department by this afternoon?
Yeah, that's the request. They've already been asked to kind of be thinking about those and then submit their list of how they would basically continue services. And part of it is whether they can continue their essential service with the building not open to walk-in traffic, and how they would accomplish that with respect to either appointments or online phone services, or having some other, say, to drop off plans, a means to accomplish that outside of their having regular business hours. So that really is the question. And the second question is, do all employees need to report to work? Are they essential, and do they need to report to work, or can they work remotely? Whether they're essential or not, frankly, can they, in the spirit of the state's directive, can they work from home? Can they stay at home?
So you're saying they'll be like working online and,
Yeah, well, it depends on the job. The lawyers in Dave's office, I'm sure, are using both remote access to their files. Could be email traffic, phone traffic, a whole range of things. Almost everything they do in their office, they're able to do from their home computer, from their home office. But that's not going to be the case for every employee in every department, so that's what I've asked the departments to do is.
Like parole and probation, there are a lot of the people that meet the people on parole or probation, they meet them at the building, don't they?
Yeah.
yes.
So that's why they all come in, so if you're not there, how do you do that? So they'll all come up with suggestions to you. And is there anything we have to do today based on this order, or what's the?
Well, the only, and I'm sensing you might want to wait until we kind of see what the departments come up with to make a sort of a overall blanket decision on building closures. But that was the only real true ask, his ears were burning, of the board, is whether to close buildings or not, if we can. So I'm sensing, I think you
Well, yeah, I
are
mean-
ready to go there, but I'm, if we want to wait until we hear from the departments, we can do that.
I spoke with Chris Doty the other day regarding the road department and what he had already implemented into his system, and the fact that we only have a limited time where we can actually fix the roads, if we have a winter that's early. And I really like what he had implemented, the fact that they leave their keys one person handles the keys, each one of them has their own vehicle, they're not, two people aren't riding down the road in the same vehicle. They're doing a lot of social engineering on a daily basis, but they've got these projects going on that need to be finished. I feel like, they feel like they're essential. Yeah, they are essential service, and, I was really happy that I had that conversation with him.
And I think they would be essential, and I think they need to continue to do what they do. The one question there is, does the road department need to be open for walk-in traffic?
They actually had instructions on the windows, so the people that were going out in the workforce were not even going in that building. They just read on the window what they're supposed to do, and then they head to their job.
So the question is, is it okay for a building to have a sign on it that says call for service? Call this, with the door locked. So I'm just, as an option. And we might do that Wednesday, but
Right.
I'm showing support for that, and you thought maybe.
I think unfortunately, yes. But there can be a number here, like on our building, that calls our office upstairs.
Yeah.
And somebody answers it, and they said, we've got this situation, we need a passport, we're so sorry. But, and those kind of things.
We write down to me.
We've got to help
because we
you.
don't have anybody in the office right now, because we
Yeah.
want to keep minimal numbers. Yeah, I'm just showing support for that.
I guess I'd be interested in hearing what the departments say. I like keeping public buildings open to the public to the extent that they need to do things here. I mean, they're not our buildings, they're the public's buildings, so I'm kind of inclined to be the last person to close. I mean, just like grocery stores. I mean, we're worried about is social distancing, but you go to grocery stores,
Stores.
you're just packed around people, and it's contrary to everything we're saying. And you walk right by them, you're standing in line right behind. I mean, it's like, so to some people, all these other things are essential, which we got to talk about the landfill and also because we've had that quest. But I guess I don't know that we couldn't have people down here kind of directing people as opposed to I just always hate the court. Is the courthouse closed now?
For the public, I believe, with very rare limitations, yes.
So you can't go watch a trial if you want to?
There are no trials.
So there's no trials.
At this moment, there's no, my understanding is they're only handling in-custody arraignments. They're trying to push trials out, but if they have to get one in for a timeline, then there would be a public trial, although I believe they're having as many people appear video or telephone as possible.
But over years, they've gotten more and more closed off as a place since I moved here 30 years ago. And so now they're closed that way. The city of Bend has gotten increasingly difficult to get to. They've gotten rid of phone numbers, they built doors, but, and I've always thought it's important as a public body to be able to serve the public to the extent we can. So to me, it's not an empty lobby and then call upstairs. Maybe it's somebody, if there's somebody that could work downstairs that directs traffic or gives people information. That's a good way to handle it. So the people, this alienation thing, people don't like, where you can't get anything done and you just, this is an experiment to shut down a society to avoid something. And I don't know, I'd like to have some continual openness in unless we absolutely can't. But you know, again, and I look at the discussions about who's gotten the virus and stuff, the big breakouts and things haven't been in government buildings. It has been now politicians have got it. Well, that doesn't surprise me at all.
politicians?
The politicians talk to a lot of people and shake a lot of hands. But it's been these facilities and things that where caregiving is going on or where there's a lot of touching. Well, this is, I don't know. What do you think about the lobby idea or something partially open?
Oh, yeah.
I mean, if, like I've got a face mask that my wife wants me to wear, and with gloves, you can be pretty, nothing gets very directly to you very quickly, and then if you monitor it, I mean, I don't know. It's my view.
Well, I do think customer service is something that we shouldn't lose. And if people, you know, come up to the door and the door is locked, but there's somebody sitting right there, I think that's a lot friendlier, you know? And if they, is there a phone right here that they can call?
Like a indoor?
Indoor phone that we could have the number and you could call them and say, hey, I'm here, I need to go up and pay my taxes, or I need to go up and get a marriage license. You know, and so the person is right there. I mean, so we're,
That desk there.
yeah, we're still providing, is there a phone there though? But I mean, you know, still having customer service as best we can.
But with the building open, or?
No, I said the door's locked, but you've got the phone number right there. So you call and the person is sitting right there and they can go and, you know, say, oh, you're here for such and such. Oh, yes, do you have an appointment upstairs? You know, let me help you.
So would that same thing go in all the other buildings?
Do you think we need to lock them?
Well,
I mean, it's like the veterans building. We talked about this last week. I know we talked about the veterans. I said if a veteran comes to the door, there's a lobby there, there's space, you know, can they be helped without locking it? I mean, I'll be interested to see what Keith thinks.
I mean, I guess I don't see it as the door's locked and we have a person here that gets there every time somebody calls, goes out to see what it is. If we're gonna lock the door when we have the person sit outside, I mean, it doesn't make sense to me to get up and, you know, we'll come out and check on you, but I don't know. Is there an advantage to not have people in the lobby? Is that what you're saying, or?
Well, I'm just saying that they'll be able to be responding quicker than
Yeah, then
somebody's
better upstairs.
Yeah, than somebody
I agree with
upstairs
that,
answering the
but
phone.
they're only a go-between for anybody anyway.
Right.
So, yeah, again, I think that the state's idea is to keep people at home, whether they're employees or customers. So what we could do is, I mean, we could, and Whitney can speak to this, I know she's already been thinking about it, if we were to issue a media blast and a social media blast to everyone, alerting them that buildings are closed. However, services, we're still providing services, and here's the various means that you can obtain service. You know, either online or by appointment or by phone. So that's I guess the first question. If you'd not like to take that step, so we have many buildings, so we would have to then customize sort of a front door policy for each one of those buildings, which is kind of what Phil suggested, a middle ground, which we could pursue also. So we wouldn't necessarily alert the public that things are different. We would just have someone, I guess, some kind of reception function at each building to greet the customer and find out what the nature of their business is, and explain how that could be done, either calling upstairs or some other means to do that. So that's sort of that second step, that second level.
Because we have the assessors, we have the property tax upstairs, we've got marriage licenses, passports. We have all these different things in our building, but if one person could facilitate, okay, where they go, I think it's good. And then I think looking at our other departments, the road department, the transfer station has landfill has their own serious issues. that they, it'll be interesting to see what their feedback is to you today.
I know they're gonna say that they're essential and that they ought to remain.
Right, they are essential. We can't have trash piling up in our county. So, I just feel like our building is a little bit more detailed because of the different departments that are within our building. But, okay, so the Veterans Office is separate there, and yet we have, CDD. And I don't know what Nick has thought about over there.
Remember, we're talking about a period of time.
Right.
When we talked about this last week, we said, let's revisit it in 2 weeks. This, it escalated today with a governor's office order. So I'm still supportive of having a discussion in 2 weeks and showing support for putting a sign on the door and saying, please call for service. Do you support that?
Yes.
Well, but I don't. I'm
Making
hearing two
sure,
different
yeah.
things. I'm hearing your sign on the door, meaning we're closed.
Well, a sign that says we're open for business during business hours.
Okay, so, there are people, so we've got finance, clerk, assessor, board admin, upstairs, HR. So it would be a number call. So in order to be able to perform those services in each department, we'd have to have staff here in order to do that. The one person would just be sort of a receptionist down here. And so they'd have to call the clerk if it's related to a marriage license and either escort them up or have someone come down and get them. Okay, so we could do that.
But, yeah, I mean, somebody usually knows they're coming in to either see the clerk's office, pay a tax bill, or talk to the assessor about something. So multiple phone numbers in our front, and I'm saying as an option. So I'm giving you the authority to have these options, is what I'm saying.
Well, so just bottom line, just so we can, what I've heard both Phil and Patty say is that you'd prefer to kind of have somebody available to provide service up front.
I think that the workload has definitely changed, and there's got to be someone, a friendly face that can actually be facilitating,
All right,
someone that feels comfortable facilitating.
so that would, that.
From 6 feet.
Right, from 6
To
feet.
me means the building.
But you can still smile, I mean, we still need to be kind to people. This has been very impactful on a lot of people, and kindness goes a long ways.
Sure.
And helpfulness,
Yeah, no, customer service is definitely an ethic here, but.
yes, and our ethic.
So we've got buildings scattered throughout the county. I'm not sure, I just want to make sure that's sort of a general directive, or if you want to look at that on, say, a case-by-case basis with department recommendation.
I would like to hear back from the departments too, but I mean, just as far as our building goes, I would hope that something like that could work. I mean, this is where we are most of the time now, because we won't be in meetings out in the community.
I mean, so adult pro and probation, how could you close that down?
Well, and that's where I'd have to rely on the department. It's an essential service, clearly. That
Clearly
building is.
essential service,
So
1,200 people every month.
Would they
are
do
on.
it by appointment only, or would they do it remotely, or what their plan would be? And
The same with juvenile?
Very similar with juvenile. Obviously, the detention will have to remain operational, for law enforcement and their connection there, for their juvenile justice programs. That I certainly would consider essential as well, and they'd have to have a plan. Both of them, you can walk in their front door, a member of the public, and ask questions to a receptionist. So that's one aspect of.
I'll bet there's 10 people a day that do that. Public, people just from the public that go in either of those buildings.
Yeah, I'm not sure. So, I mean, that's the question.
I was surprised the sheriff, closed his off, because to me, it's like he's real, so he must not think he gets very many people that come through there even, so.
Right.
That'd be something to know too from the departments, how how many members of the public are we talking about in each of these buildings? Like, we were at the health building for that meeting on Friday, you know, and they made us, there's somebody there making you do this and do that. You know, they have all these kind of rules. And
They took my temperature?
took her temperature because she had a cough or something, right?
Yes.
But they made me wash my hands, and that's good, but we never got to whether the building was open, and I couldn't really tell, you know, not very many
Right.
people came and went while I was standing there, so.
Yeah, I'm assuming.
But Mosaic's clinic is still there, so do you close, I mean, do they, but they are just apparently discouraging people from coming, which is odd to me, but, because they're health clinic, but, then, and I don't know if we're seeing a full cadre of people in that building still, or how many people are working, whether all the WIC people, I don't know.
Well-
So it's really that kind of stuff, you have to almost break it down to what's going on, when then they got that, like, that building in Redmond that we have all those services. I mean,
Health has, 6 to 8 buildings,
Yeah.
plus the school-based, well, the
Yeah.
school-based health centers would be closed with the schools, but, yeah, they've got multiple locations, so their analysis would cover each one.
Could we take a 10-minute break then? Is this okay? At 1:30, is it 1:30? Yes.
So I think we've covered that category, the stay-at-home order, so if you're concur with that, when we come back, we could start with business assistance, unless you have other
Sure.
questions on.
Business assistance. Okay.
Okay.
So.
10 minutes?
Okay, so,
Commissioners, we know that assistance to our local businesses has been an important issue for you since the start of the pandemic. And with David Given's help and working with Whitney and with our IC and JIC, we've been trying to coordinate and line up where businesses go for assistance. So Whitney and David have put together a pretty extensive one-stop shop, so to speak, a web page where both links to information resides as well as a live contact for people to businesses to contact to get specific consultation and guidance as to what resources there are out there for them. So I think, Whitney, are you going to articulate that, or you're not pulling up the web page? But I think you're.
If that would be helpful, would that be helpful to pull it up and look at it, or would you?
Sure.
Okay. I will pull it up there.
and I noticed the Chamber sent us something this morning that they've done some work too.
They were creating a site. They sent a note last week, and I know David has been pulling updates onto the website as they become available. Pull this
I
up.
think, one idea I shared was with the Bend Chamber, what Lapine Chamber done, it was a list of all the restaurants. And I think they've done that, and they've done, I saw that just now on the
We went and got pizza from the pizza place yesterday, just to show support.
I did on, I guess it was yesterday, no, it was the day, on Saturday, I did the same thing. Yeah,
Yeah, well, Chambers of Commerce, that is a business service organization, membership organizations. That's their goal in life, is to help business.
Yeah.
We want to show support also, and I have been chamber member for many years.
So, and plus, when you actually pick it up, you need to buy a gift certificate too, because that's what I've been doing. I just think it's,
well, I'll take some of your money and buy the gift certificate.
I will give you
'cause I
some.
bought a
Oh.
$30 pizza, I
Yeah.
thought that was a good,
well,
plus a tip. I thought I gave mine that day.
Well, I just know that when I talked to so many people who were shutting down their restaurants last week, and the ones that are trying to, there's only like 2 people left, and, the coffee shop just closed this morning. Sisters Coffee was still open, but Rancho Viejo said they had a great Saturday with their takeout, but last night when I went there weren't that many people. So they were, it's going to be touch and go. And these are the small business employers of our community. And I want them to be here in 3 months, 2 months, whatever. I mean, and it's going to be hard.
Well, I think we all do. It's just going to be, there is apparently quite a bit of financial aid for the restaurant industry, the lodging industry, the travel industry. I mean, it's billions and billions. I mean, I was looking at it last night. It's huge.
But
I don't know how it
usually
gets- I don't know
getting
how it
that
gets spread.
down there is,
Yeah, well,
that's
I don't know how they're doing
that's the
it.
issue, Are they going to be able to actually
Well, and
get
that's where
it?
we can help, plugging into what is happening at the state legislative, if money is flowing, and understanding what the federal buckets of dollars are also. So I noticed this is the front page of the Deschutes County website.
Right, in the business resources page, we've highlighted on the front page of the website. So that's a great way for residents to access it. And David is really doing a great job of updating this because information is fluid at this point. And so we found out last week that Oregon is now recognized for SBA disaster relief, and he was quick to put that link, that live link right on the top there, so that's clear for folks. And then we have a variety of other sources where we're linking out to other agencies. So we've kind of bucketed them by federal resources, state of Oregon resources. We're talking here about financial assistance.
So this is not the main site, this is something you can get to from the main site?
Correct. This is linked on the homepage, and this is business specific. We're also, there are a number of local resources. The City of Bend has a great page for businesses. EDCO, the chamber, as you mentioned, we can get that added, so we're doing our best to also link to those folks here. And then David's been pulling a number of PDFs for different types of businesses up onto the webpage as well. So as Tom mentioned, our local contact for Business Oregon has agreed to receive emails from business owners, and her direct contact information is listed on the page. So that's really at this point where we're directing folks to reach out if they have specific questions. Obviously, we've linked to the City of Bend's page as well, and they have staff I know that are working on this specifically within the city. So if there's any feedback that the board has or other things that you'd like to see us add to this, resource page, we're happy to do that. But this was really an attempt to house, there's a lot of information out there, and house resources that would be helpful to business owners in one place.
Excellent. Thank you.
Yes, you're welcome.
I wonder if there's some way to share that fact. I'll bet that's kind of the gold standard here with what you've created. I wonder if there's a way to share that with the various news organizations.
We can definitely do that. Or we could share it. I know the press is really following our social media right now, and we can definitely share that this is there in a resource, and I think that they'll pick it up for sure. So David.
Announce the creation of this,
Page.
comprehensive web page.
Okay,
We'll put it on our Twitter feed too.
you've got it.
Thank you.
Okay, well, that's a good segue into the next item on communications. So I know the sheriff is looking to join with you tomorrow on a press conference. Tony's come up with the idea of a video, and there may be some other things. So I've kind of put that into a category that we can talk through at whatever depth you'd like, and Whitney's going to coordinate that as well.
So I sent a note on Friday, and right now that press conference is tentative. It's still not completely confirmed, but the sheriff was asking if the board would be interested in joining with him as he potentially hosts a press conference. And I know Commissioner Henderson confirmed that he would want to be in attendance, but I just want to make sure that I communicate to the sheriff's office if we have other attendees from the board that will be attending. And I think we'll get more information from the sheriff's office as plans come together for that.
Yeah. My understanding that what he's doing is trying to focus police and fire and emergency, kind of that focus of the community's safe, and so we're taking this up. So I thought if I said anything, what I would say is just that we've contributed to like the request for additional supplies that we did, and we've had continual updates. But it's kind of a public or law enforcement, fire, safety focus, so.
You're correct. But he obviously welcomes your participation.
Yeah.
I think due to social distancing recommendations, they had asked it for just sort of one speaker per organization. So if between the three of you, if all of you were in attendance, we maybe would just have one person deliver remarks formally, and I'm happy to work with you on the details of that.
So what time is that supposed to?
Tentatively noon, but again, that hasn't been formally pushed out yet, and I think they're still in planning, so those details could change.
Okay.
They're also starting some kind of like a nonprofit, what's it called, Deschutes Strong or something like that, to raise money for the benefit of police and fire, emergency, and their families, and kind of if it becomes necessary. That's going on, I think, right now. They have a phone conference or something about it, but I don't know any more than what I just said.
So, yeah, I mean, to show support for social distancing, I don't know that I would need to be at that conference. I mean, I support having a presence there, and, if one of you want to speak, whatever, I don't know that I need to be there.
That's all folks to know. Thank you. The other concept that had come up, Commissioner DeBone, was potentially discussion about a video, and I'll defer to you because.
Yeah, so just all kinds of ideas and some short statements that we could be making, not real long, really, kind of a, what the domain is. In fact, we're learning today, supporting business, understanding legislative, making decisions for the county, supporting an incident command team. There's just very specific things that we could be referring to.
Yeah.
Kind of a nice, sharp video too. I mean, this video here is of the room with our audio, and audio is important, but just a little bit more personal.
Yeah, I
Either the
like
three of us side by side and focused on each one of us, or three individual statements that could be played
Maybe in
individually.
different settings, or,
Yeah.
I like the idea of trying to fill in kind of what the county's working on.
Yeah.
Kind of how we fit into it, because people are real aware of, like I was saying, the president's on every day, the governor's on a lot, and you don't see what the local, and all I know kind of about the city is it seems to have kind of, it seems like it's kind of shut down, but I don't know what they're doing.
Well,
But
the mayor will
because
be on the
most
TV
people,
at some point, and it's just.
but most people don't know we're the health authority, and we don't,
Yep.
you know, that's just
And
starting.
that's it, some of the basics. People are starved for facts right now.
If
too.
we could come up with a kind of a script or a top 10 points and we figure out we could divvy them up, and I think that'd be cool.
And I'm
Don't you
envisioning
think?
down here, maybe sitting at this dais and everything too.
And I would like to be able to tell the residents what is the condition of the 10 people that are positive. I think our residents deserve to know if they're in the hospital or if they're not, because, you know, and I just think that's really important. I would like to know, and, you know,
Well,
I think it's a positive information for the community, since our percentage is higher per our population.
And at one point in the JIC, we had tentatively, we were talking about potentially a joint agency collaborative video message that would include a variety of local leaders, like the sheriff, like yourselves. And I don't know if what I'm hearing from the board is you'd prefer a county-specific, more in-depth message, or if you'd be open to pursuing that idea or both.
Well, we could probably do one that was just county specific. We got quite a few talking points. I
We have
mean,
a
we
lo-
don't, we can talk about what we're doing. We're not, you know, the state, we're not, the sheriff, it sounds like, is taking a couple of initiatives that are good, you know, and are focused on law enforcement, so I don't know that they all have to be in the same video, that maybe we should do something that creates what we're doing.
Yeah, that's helpful.
Because it's,
And remember, they're only going to want to watch about 2 minutes.
well, and that's the idea, short little statement.
Short
Got
and
a nice
sweet.
High video quality, so it's a nice personal type feel. People are looking at them at their phones, on iPads, and on the computer these days.
Yeah, I will get a draft together and get it back to you for review, and also with a few options in terms of how we might shoot that in a way that allows for maximum spacing and keeps in mind all the things we're trying to implement right now, if that sounds good to the board.
It sounds like a great idea. Where's my 6 feet, you know? It's like, oh my gosh, things are spreading out.
You need more than 6 feet?
well, you've been coughing on us for a week,
3 weeks.
3 weeks.
3
Oh, my
weeks.
goodness.
I know.
We've already got whatever you have.
I know. I told my husband if I would be in a high risk, if I would have been like a smoker or a vapor, because I always get a cough. I mean, always, my whole life.
Yeah.
That's why I married an ENT,
Oh, yeah?
ear, nose, and
Well,
throat
that is
doctor.
smart. I
There
never,
you go.
I've
It's
had,
very strategic.
yes, you've got to pick the right,
Out.
right medical practitioner to be married to, so I did it. Okay, yeah, I always get a cough. All right, so where are we at now? Communications updates, we've done that?
Vacation caps is the next one. So this is an issue, as you may know, we have limits on how much vacation each of our employees can accrue. And there's an April deadline each year on, it's basically use it or lose it on those limitations. So the sheriff was the first to bring this up, and he says, you know, I got all hands on deck right now, and I had people who were scheduled to be on vacation, and they're going to lose it because I'm making them work. So he suggested that we lift that use it or lose it provision just for this calendar year. So if we do it for the sheriff, I'd like to do it for countywide. So we're not granting any additional vacation to anyone. We're just delaying the deadline because of the pandemic on when employees would be able to or take a vacation later when things.
so is the April deadline for vacation that accrued last year?
But
Or-
their total accrual. You know, it could be accruals that, you know, people have, some people just don't take many vacations and they're up against the limit, which is,
But why is it April? I don't,
that's just our annual deadline.
Not a
April
fiscal-
30th,
There's nothing
April
magic.
1st, what day?
It might be the first, yeah, I don't recall exactly. It's either sometime in April. Do you remember, Eric?
I think it's through the April payroll. They make you identify what you're going to do by the end of March.
well, what if we did it I mean, do you think it's unreasonable to do it for 3 months or 6, you know,
Well, just,
instead of 8 months? I mean,
Right.
I don't know what to expect. I mean, we don't know. We haven't been here before, but
well, we don't know how long this is going to last. I know the sheriff's pretty set on wanting to do it for the calendar year, so and, you know, he's an elected official, so if we can, I'd prefer just to align them so there's not confusion. Again, we're not granting any more, we're just extending the deadline to use it.
Use it or indicate use of it, is that what you're saying?
You either use it, or if you have enough, you sell back and get paid for hours. And if you don't do one of those, or if you've done what you can, then you, in essence, you lose those hours. I think there's Eric could talk to the emergency thing that it bleeds into, I think.
Yeah, if you don't use it, you don't lose it. It goes to a separate sick bank that you can only use if you're sick for 3 days or more. And then that special sick bank is not paid out at retirement. So that's the perception of losing it, but it goes to a separate sick bank that can only be used for an absence of 3 days or more.
So if you extend this, you're using the stuff that's accrued by April 1st for the prior year before that, and you're extending that for the rest of this year, and then next April, what are you doing? Just the 4 months, or you're doing the 12 months before that?
Again, we go back to the aggregate accrual for next year. So, whether it's accrued the rest of this year or the first 4 months of next year, there's a hard, it's not a limit on annual accrual, it's an aggregate limit on how much total TML an employee has built up.
I mean, if we're still dealing with this in 8 months, we've got way huger
Yes.
problems than that. I mean, the economy, we'll be in a,
We have scenarios where scheduling and lack of staffing has prevented people from comfortably taking vacation. I mean, because that's the scenario I can support. Otherwise, it's a shame that people are riding the maximum after many years.
In the past, a lot of the requests come out of the sheriff's office and during wildfire season, if wildfire season impacts people's ability to take time off.
But in this,
I see it going both ways. I see this being a slowdown that would reduce people's need to be here. We're telling some people, so it's going to be splitting. One department may
sick
be
bank.
really busy, another department may be really slowed because so it's like, it'd be a good time to take a vacation. So I don't know.
But you can't take a vacation because you can't really go anywhere.
Well, you can take a vacation, stay home.
fertilize your lawn.
Yeah, I mean, that's what the rest of us, that's true for everybody, not just county employees. We could do, you suggesting we should do away with vacations this year?
Never.
Okay. Can we talk to the sheriff about it and decide on Wednesday?
Okay.
I guess I'm just a little unclear. Is that what you're saying?
Oh, he's going to be a very strong advocate. I'm just digesting it. I'm sitting here thinking, oh, geez, how do we end up with this scenario? Is this referring to somebody, what's the maximum amount that people are bouncing off of?
The personnel rule or the leave policy states is an employee can carry over 2 times their annual accrual.
Oh, okay.
Anything above that is what gets
Yeah.
moved to this sick bank.
See, and I was thinking it'd be more than that even. So that's not as, so 2 years worth of vacation
Like 10
Accrual.
weeks or 12 weeks, they can.
for
move
a
forward.
longtime employee.
Correct.
And we're just talking about the part, if their maximum is 12, but they've got 14, they lose that 2 at the top if they don't use it, or by end of April or 1st of April, or whatever it is.
Yeah, it's like if somebody's annual accrual is 100 hours a year, they can carry over 200 hours, and then anything above 200 hours would go to the sick leave bank. And again, that sick leave bank, upon separation from the county, is not paid out, so that's where.
Isn't accrual more like their annual's 200 hours and they're carrying over 400 hours?
Well, whatever their annual.
Do we have anybody that's, I don't know what the week averages are, but I'm doing weeks, but you're doing hours.
So that's like 2.5 weeks, you're saying.
100 hours, but I think it'd be
That's the
more than that.
vacation, but
If probably a new employee who, and also employees accrue differently if they're exempt or non-exempt.
Right.
But an employee starting out is, I want to say 8 hours of, either 8 or 10 hours of leave. I could look it up real quick.
Per month.
So then multiply
You're
that by
135.
12, and then 2 times that.
The first year, you're 100 hours.
And again, the time management is sick leave and vacation combined together.
We can bring that back on Wednesday with some specific
That'd be great.
scenarios. So it's clear. Okay.
Thank you.
Yep. So just kind of working down the other issues. So we, I think in Kathleen's meetings with you, and what we kind of heard last week was that you're supportive of a hiring freeze for non-essential personnel. So I just wanted to confirm that, and then we'll make the, issue that directive within the organization.
Yes?
I agree with that.
Okay?
And then, yeah, special requests could come through if you think it's a
there's an exception,
priority,
yeah,
yep.
but
And
I-
then to look at it about a month from now, or, I mean, I'm just thinking, the world looks different day to day right now, so how would?
Yeah, I
how
think we
long
should
would
be looking at it periodically. I don't know what.
Yeah, so when would we want to bring it back? A month? Or are you suggesting anything?
I would probably leave it in indefinite, just because we don't know.
Or just
but-
keep it in
but
for a
there
while?
will be, if things start to slow down, we begin to recover, there will be self-generated pressure from the departments
Okay.
to request a lifting. of
So it'll
the
come back when it's mature, ready. Okay, I got it. Just making sure.
But you know, from our perspective, it hasn't even started here, really. I mean, 10 cases. So
Yeah, and
it's really, does it go through a peak and then come down or something? Or was it just never happen here, I guess, or everywhere else? You know what I mean? It's like, we don't even know where we are in the cycle.
Yeah, I guess I'm sensitive to not, you know, if worst case scenario, if this thing really affects our long-term finances and our
Yep.
ability to
Yep.
perform service, that if we bring someone on and then we have to turn around
Yeah.
and, you know, lay them off later, then that it'd be best just to make do for the time being with what we've got.
Yeah, I mean, if values go down, or if the economy really just slows down and stays slow, I mean, we could be working in a smaller organization. Maybe, I mean, we could have a strong V too, we don't know yet.
That's, you know, I think it sends a message also that we're,
Yep.
you know, being prudent.
Yeah.
Okay.
All right, we talked about remote work a little while ago, and I think Joe's still here, just to kind of give you an idea of what that looks like in our departments. Joe's done, and his staff have done a ton of work trying to ramp up our capability for departments to be able to access the systems and so forth that they need to be able to do their jobs remotely. So, I'm sure Eric can probably speak to the HR side of it in terms of the contracting, but thought that might be useful for you to get a better understanding of what that looks like. So, real quick, Joe, some kind of a
Yeah,
summary.
so real quick, just like everybody else, the pandemic caught us by surprise.
Joe, do you want to introduce yourself?
Oh,
I
sorry.
think we're still on film.
Oh, sorry, yeah. Joe Sidoni, Shutes County IT Director. So just like everybody else, the pandemic caught us by surprise. 2 weeks ago, we learned that it was a very high likelihood we were going to have a number of employees telework, work remotely. And we certainly did not have the infrastructure in place for the number of employees that were anticipated to be working remotely. And so we decided on 2 solutions, executed on them last week, and are deploying them as we speak today. We have, from my last estimate, probably better part of 300 employees working remotely. And the deployment is ongoing. It's a little fragmented and disjointed right now because we're essentially deploying solutions that are a work in progress, right? So they're not finished or polished. We just didn't have the time to do it. But we knew we could execute these solutions and that they would work for a certain number of people. And so we're doing it. We have probably a better part of, we have a number of people remotely connected doing work, and we're still working on dealing with requests that are still coming in as we speak. This morning we got requests for the entire Veteran Services Department, from HR, and from community development for more of the ability for remote workers. We're setting up the entire Health Services Department, so every employee essentially does not have the ability to telework. We're deploying it to every employee there, and we've set up admin employees and most of those who have already requested it. So it's working. It's working okay, right? It's most of it is most of our support issues come from people learning how to telework, right? And you know what it means to telework. For a lot of us, it's the first time that they've ever worked remotely. So there are obviously challenges to that from a learning perspective, from a use perspective, I guess, of the technology. But the technology seems to be working. So that's kind of where we're at today. You know, where we go from here.
Question, what's being offered? Remote desktop to their desktop computer?
No. Well, yes and no. It's one of the challenges for the deployment is from department to department, the needs are different.
Okay.
And so it was another reason why we decided to deploy 2 new solutions was to meet, because we already had an existing one, so we have 3 solutions today that people are using, the existing one and the new ones. And so, and not only is it different from department to department, but it can be different from employee to employee. And there's a lot of factors.
Are you
that
providing
dependent.
hardware to go home with folks, or they're
We are-
providing their own desktop?
We are dependent on the hardware that the department currently owns at this point in time.
That the department home, so is the employee bringing home hardware?
Yes,
a
they're
computer?
laptops, not
Laptop?
desktops.
Okay,
We're not recommending at all
yeah.
that employees take.
Laptops are
computers.
going, yeah.
So if they have a laptop already or have access to a laptop, that's how we're getting them home.
And then are purchases happening also then? I mean, some hardware being purchased right now?
We have purchases that were already in the pipeline. They're mostly for health services. There were some other ones that were already there. We've pushed up the deployment of those
Okay.
to be able to get those employees out.
Great.
I'm not going to call it a success because it's a struggle on all fronts to actually make this happen in the time frame we were asked to make it in. But we're getting better every day at it.
Great. Thank you.
Yeah, thank you.
So I was told yesterday that, okay, so someone logs in. Is there part of the system that can actually verify that they're still working and it shuts off in 15 minutes if they're not doing something? So that we actually know people that are working from home are actually doing the work?
We can tell from our end, from the source end here,
Right.
who's connected.
Okay,
We have to actually actively go in and look and see. We don't have something that's telling us constantly, right? But we can bring up a list of, in each solution, who's currently connected.
okay, but to be connected, you could be connected, but you could be watching Netflix over on the right side. Is there something part of our system that can tell us?
No,
No,
there is not.
there's nothing, okay. Because another county was explaining to me that it was possible, so, but not yet for us.
No, not yet for us. I mean, if we had a system in place that was specifically designed to do telework, and that we knew we wanted to go in and be able to monitor the work that was being done, we would have put that in place, right, ahead of time, right? But this is a reaction to an emergent situation, right? Trying to get people to work from home and getting the service out the door.
Well, we were just talking with Nick, who explained that people have specific assignments, and, you know, so he knows what he's expecting to see back. And we haven't heard from other department heads yet. I did talk to someone in private industry, and he told me his experience was that there was no way he could pay Susie to work from home because her work output was like a quarter of what it had, you know, been when she was inside the business.
Sure.
So, okay, so we're then going to have to count on our department chairs to actually stay on top of this?
It literally, those issues are operational issues, essentially. They're, employment issues. It's not IT's purview.
Yeah, so along those lines, so we updated our operational rules for work at home, and those were embedded in the temporary leave policy that you passed last week. So each situation for remote work must be approved by the department, by the department head, by the supervisor, and it's really incumbent on the supervisors to ensure that remote work is getting done. So there's a form that requires a description of the nature of the work, the equipment needed to get it done, and it's essentially, it's not a legally approved contract, but it's a contract, a compact between the employee and the supervisor, where they agree to the work that's getting done. My sense is that most supervisors, they'll know if an employee's not producing or not getting work done at home, they will be able to flush that out. But again, that's incumbent on them to be able to do just that. And since they understand the nature of the work that their employees are doing, I think they'll find out pretty quick if there's not work getting done, either through, again, specific to the nature of that particular type of work.
But, to me, I think the thing that's important is to get the message out that we're really, those that work for the county, including ourselves, are fortunate to have these jobs because we're not immediately cut down because something is forced to closure, whatever. So I'm just hoping people work hard and figure out ways to take good advantage of this time, off that the rest of the people are going through, because it's huge. I mean, I don't know, it's up to managers to manage their departments, but to the extent you can keep involved with that too, it's important. But to continue to have health insurance, and I'll tell you another thing, to have a retirement system that isn't based on the stock market is a very nice thing too, because you don't see it go up and down like this the same way. So anyway, I'm sure everybody gets that, but.
Thank you for getting that going. A little bit of overtime maybe for your guys or whatever's happening, so guys and gals. So thank you very much for putting that in place and getting it going.
My staff's doing a great job.
Yeah, good.
Thanks, Joe.
Thank you, Joe.
So again, real quick, travel, employee travel. This is something that came up last week in our sort of brainstorming on issues associated with the pandemic, and we realized that lots of employees had travel scheduled. It involved plane flights, in some cases, maybe international plane flights. So to the extent that employees haven't already canceled them, there's going to be some that will travel, and so what happens when they come back to work? So we wanted to have a mechanism in place that if they travel somewhere that's a place that's undergoing a pandemic itself, that we had a defensible means to get them to self-isolate before they come back to work here. So Chris Bell has drafted a policy. We're in the process of vetting it with legal and HR and admin, and we'll share it with the board once it's in a presentable draft, but we just wanted to give you a heads up that this was being created.
So we have people this week that are on their planned vacation.
For spring break.
Right, of course. So they're not going to know what our policy is until they return.
Yeah, Dave, I'd ask you to jump in terms of effective date and what we're trying to do.
I mean, can we make them quarantine themselves? When,
Write them a check, you absolutely can.
Well-
But we're trying to figure out, if you don't write them a check, can you make them self-quarantine? There's union issues as well that come in to play, so it's far more complicated, and each time we peel off one layer of the onion, there's more issues that are cropping up, and so Christopher's been working on this along with Kathleen around the clock, and it's sort of evolving as some of the changes at the federal and state level occur as well. So I think, as Tom said, stay tuned. We hope to have some clear direction or advice that we can provide, in the next day or two.
So are you talking about just people that fly to China or northern Italy, or are you talking about anybody that leaves the country or even parts of America?
That's part of the difficulty with this is, Chris included some initial language that just spoke to like a hotspot or an area where, there's an unusual number of cases. So we're kind of struggling with that, frankly, on how we draw a box around, it could be ranging from any flight period to a flight, an international flight, or a flight to a desert, Seattle, New York, or San Francisco. So
we know if they flew to Hawaii, they had to go into a 14-day quarantine. So probably those
In Hawaii?
Yes. So those trips probably got canceled because there was cheap fares, but then they have a 14-day quarantine. So,
$99 to Hawaii.
I just gotta stay there 2 weeks, that'd be, what a
well,
bummer.
stay there 2 weeks in quarantine.
Before you can see the sand, though.
Yeah. So,
Interesting. Well, I thought the federal government was saying nobody should travel out of the country. I've heard him say that. I mean,
yeah, well, and that will help, in fact, if that's in place. But, I don't know. I'm sure there are exceptions for certain things. If you got a sick mother in another country that you have to get to, or, I don't know. So we're just trying to cover all
do
bases.
you think that very many people are affected by this policy? I mean,
a couple.
5 or
I think
10?
we're aware of about 4 or 5 at least that were brought to our attention, that were in kind of a pending status, that had already bought tickets. Some of them were getting ready to leave. Some of them, I think, had already left. And that's what brought the issue to light, which is, okay, when they get back, do they just show up on the floor and potentially cause an issue if they, or now the whole workforce, has to be quarantined if they bring something back?
Is a 14-day quarantine the only reasonable one? I mean, would a 7-day catch 90% of problems, or?
I guess we'd have to ask
14
Dr.
is the
George
magic
that.
number.
Well, I hear it all the time, but is it really magic, or is it just?
Okay, so my son's boss went from Costa Rica to Milan, and she went back to Costa Rica and did a 7-day self-quarantine, but normally it's been 14 days from everything I've read. So I just thought that was interesting.
I think it differs if you're showing some symptoms versus if you're
Right.
not.
And frankly, the difficulty is we don't demand to know where our employees go on vacation.
Exactly. We hadn't in the past.
Seems like if the president can stop all travel from Europe, it seems like we could demand to know where people went if they went to a hotspot or something, couldn't we?
You're
working on it, huh?
ORS Chapter 401, it's sort of the isolation and quarantine Bible, an emergency Bible, and county lawyers know it, read it, and until a couple of weeks ago, it really...
Nobody cared.
It was smoke for a week in the summer, or a flooding in February in 1996, and that's been about it. So this is all new ground, and time's going to tell if what orders were issued were legal versus weren't. And if the board were inclined to put those types of orders in place, we could certainly tie it to language in the ORS that would certainly appear to provide that. But there's a lot of nebulous language that speaks generally to a lot of these things, and it talks about the. I can find the right pages of it where we have this, but a lot of language in the. Establish procedures to prevent, minimize, respond to, or recover from an emergency. All right, what does that mean? This is a pandemic, we've never had this, so there's not gonna be any Oregon law on point. It's gonna be people wearing black robes now, or in years, a few years down the road, that'll decide what that means in this context, so we just don't know.
Well,
That's why we're going
My
at
only
it.
advice is I'm glad you're doing it and looking at it. I think anybody that puts us at exposure should be, we should think long and hard about what we do, because, I mean, I know, we didn't even take my son to Washington State to see his relatives because I didn't want to sort of go, I can't imagine going anywhere. But
Well, yeah, and that
so
was one of the questions that came up, is it, you know, we're always assuming an airplane, but what if you go to Beaverton for the weekend? Washington County's got lots of cases.
Well, not
You go, you know,
Well, not
for
for-
Oregon,
population though, I mean, it's,
you know, but in terms of just numbers, I mean, would that then require you to quarantine if you come back from,
Well, I know the people on the coast weren't happy that all the people
Yeah.
in Portland were going over there, bringing their germs, and then, you know, maybe overloading their health systems, because they're small communities.
That's on the news, yeah.
Yeah, really small communities, so.
All right.
you know, we're studying it and hopefully get some.
Well, I heard about that last week, so what a
The
problem.
next one is board meetings, so we got another meeting scheduled on Wednesday, where really the only thing now that we move the public hearing is just talk about coronavirus. So question is if you want to keep meeting like this, like we are today, or if you want to try and go to some kind of a virtual meeting where you know, you would kind of call in remotely and we'd have the whole thing remote. Just based on our earlier discussion, I'm thinking you probably want to keep meeting like this, but we wanted to put it on the
Oh, I
list here.
I'm personally don't care if we keep meeting like this. It seems kind of inconsistent with everybody else. I'm more interested in, if you're taking that from the comments about people being able to get to the public, or to their, that's different than, I mean, there's nobody is here, and the only advantage of doing it is, I guess, to be televised, and it's easier to talk than it is over a phone, and 'cause you can see who wants to talk next, and
I'm available to do it remotely. Why don't we try it on
Yeah.
Wednesday, see how it
Yeah.
goes?
I'm good with that. I may be in my office doing it, I may not, but,
Oh, I can be here.
So
well, I can be here, I'm just saying, do we
logistically, Whitney,
think we're setting a bad example, I guess, what I'm wondering, if everybody else is canceling? Is what I'm thinking about.
mechanically, how would that work on the remote?
I think in talking to Joe with IT earlier, we would likely use an online meeting platform, which I'm sure you've gotten a number of invitations in the last week or so that are doing that. And we could definitely do one-on-ones to kind of walk through those steps. But I think essentially you would have a link that you could click to launch the meeting, and we would also have the ability for the public to join that video meeting as well. So you could either, if you wanted to, be on a laptop and have your camera on and your face would be on the screen, or you could join by audio only, whatever your individual preferences would be, and staff would have those same options available to them as well if they were joining to provide you an update on an item.
Well, and I would not have known that Google logo of Kathy and I was going to be on the big screen at AOC when I turned my camera off. So these little things you need to learn about.
Yeah. Well, or the other thing, we could do a limited where only one or two of us are here, so that there's a video feed of the topics, but, I mean, I was just, I don't know.
Joe and I were brainstorming earlier. I think there is an opportunity to, we could still use our live streaming system and show the online meeting in the way that we normally televise a board meeting online. It's just something new that we haven't done before, but we can definitely give it a test run in terms of what that all looks like on Wednesday, and obviously test run before then as well, if that's the direction that we're heading in.
Well, but if we do an online meeting, do you mean with one or more of us not here, but we're still here on the camera? Is there some people still here?
We could do it that way. We could also do it where the system is able to show a desktop, and so we would likely just show the online meeting through the link that gets broadcast on your meeting portal. I know that's getting technically into the weeds, but essentially.
Was it gonna show an empty room?
it wouldn't show an empty room. It would likely show the participants in the meeting. So let's say Commissioner DeBonne joined virtually and he had his webcam live and Commissioner DeBonne's face was there and then maybe your face was also there. That's what the public, if.
Do we need cutouts?
I just shouldn't be here.
We'd like to have you live.
We saw that at AOC. I mean, we had that at AOC last week, and so one commissioner, I can't remember who it was on there, from Jackson County, and so he's in his office, and you could see him up there moving around and stuff, and it's interesting. I wouldn't want to do it, but, because,
I'm up for it.
I need to come to town and buy groceries, so I'm happy to be here.
I just didn't come to work.
Yes.
So we'll do a reduced attendance.
And I know I tried a Zoom meeting tomorrow, and my computer does not have a microphone.
We can troubleshoot that.
Yes, yeah, I was practicing today, and it was not working, so,
Okay, we will touch base offline on that, but we can get that running.
thank you. It was good that I was practicing today.
Sometimes a headset with a microphone really works well, because you have isolated sound and a microphone at your mouth. I did that with my parents. I found out that, oh man, does that work a lot better, instead of just trying to.
Yeah, that's a good point.
Microphone in a room. You know.
Yeah, it's a lot better.
But does that mean I need to go shopping? And it's probably not open.
Maybe have
so
one
that
in
means I
the,
have to-
maybe Joe has one over there for you,
Oh, okay.
or somebody.
Didn't you get set up with new laptops with cameras?
I have a laptop.
I have, what? That's for home, though. I was using my computer in the office.
But for that purpose, I think your
Yeah, the
laptop
laptop.
is gonna work really well.
Yeah.
It's better.
It is way better, and we'll just automatically kick off for you, so we can,
Okay,
So she would bring it in.
yep.
so that means bring it back in. Why did I ever take it home?
Because
All
you're
right.
supposed to use it from home.
Yeah.
That's what I
That's
mean.
what I do. I use it from home.
Okay, bring back.
Okay, next item, recycling. You were all sent, or forwarded, a note that was sent to our solid waste department about why don't we close the recycling side of our solid waste operation at Knott Landfill. And I think you were all given a draft response that Tim put together with some edits that we provided. So I don't know if you have that handy?
I didn't get to it yet.
I remember Tim saying that he's really worried that if we don't have the recycle availability, especially for those things which should not go in the regular dump material, that could be a real serious problem.
Yeah, and that's really the theme of the response, is that,
Right.
it's very politely worded, but basically the gist of it is that it's, number one, hard to close just recycling and leave the garbage side open. One's a contractor, one's staff. And also that if we close recycling, that people are gonna throw things that would otherwise be recycled in with the regular trash. And for some of it, it's not a big deal if it's glass or aluminum, but other things like electronics or batteries or other stuff that could not only really create a health hazard out there, but also kind of run us afoul of our permit. Tim also, he didn't put this in the draft note, but I know he did a sort of a poll with his colleagues in SWANA around the state to find out what they're doing, and none of them are shutting down, period, but not shutting down one side or not just shutting down recycling. So that's the gist of the response, is basically just as respectfully as we can let the citizen know that.
Okay. They sent the one email, but then they sent another one, so hopefully this will,
Oh, yeah, we'd love to, and that's from Tim with an obvious copy to you also. The
yeah.
person who sent it knows that you're in the loop. So if you have any comments on that, if you let us know, ideally by the end of the day, so we can.
Well, just in terms of the policy, I mean, I wasn't at the recycle, but I was at the landfill today. I mean, it's one thing where you don't really touch people much. You just put your stuff out there and they do it with machines. And I don't know, in the recycles, nobody paws through your stuff really. You put it in the bins.
Hand either, I'm not sure.
Yeah, they don't,
The people at the scale house are all, they're doing some very sort of aggressive distancing and cleaning, and they're wearing gloves and masks there, and.
I took masks to the two girls in the way station today. My wife's been making masks, so I took them too, so that, because the one had a bandana, you know, a bandito, and the other didn't have one, but
But all
I think they all should have them. Well, only one guy in the landfill, or the, you know, the building had a mask on. I was surprised. I was like, it would look good if they all did. I don't know if it really helps them, but it kind of sets a tone for, I don't know.
Well, we've got all these people in the county that are making masks, so I'll tell my friend Kate that we need a lot of masks then for our employees.
Well, I think the health department pointed out that wearing a mask when you're sick is the time to do it, so you're not spreading. Wearing a mask, you know, so I don't know.
agree with
they're
what they're
not
saying,
suggesting
but on the
that
other
everybody
hand,
wear a
it's-
mask.
if you have a mask on, people can't get
Yeah,
moisture to your mouth area, so, and your nose area, so in terms of being, yeah, no, they have said that repeatedly. But look at the pictures from China, everybody in the picture has a mask on, in Korea, so they're not taking this. You're right, it's supposed to be if you're,
It's a reverse,
but it still is, you're less exposed if you have a mask on. And in gloves, you have less things you're picking up from everything you touch, and you're less likely to put gloves in your mouth or
you
your
are,
ear.
yes, much less likely.
Well, I think so. So, so are we voting then not to close it at this time, or, is that what we're deciding? We're supporting his decision?
No submittal from Tim yet, but I know that he's gonna say that not landfill and the transfer stations are essential services.
In his memo, he says we're reviewing it, evaluating possible closure on a daily basis. I'd probably just put on a regular basis. We're not really living day to day. That sounds like we're maybe on a regular basis.
well, things are happening on a daily basis now, though. That's,
Well, not so much at the landfill, I mean, or the recycle.
It's essential.
So in this, is this person that's suggesting this known to the staff or anything, or?
That I'm aware of.
I don't know who it is, so.
I think they live right out there by it.
I just see it as very different than a bank lobby or restaurant lobby. The employees are literally shaking hands.
I'm not sure where that came from.
I never shake the guy's hand.
yeah.
But the front, this is at the recycle center. I never shake the guy's hand when I take the newspapers or the cardboard boxes.
I'm not sure where he gets that.
Well, maybe, I don't know if he commented on that in the email, but he might clarify that issue. Because if that was going on, that would concern me. You know, that would be something maybe Tim could include in his memo. That surprised to hear the report of handshaking or something.
We haven't been doing that for a month.
Well, I do it sometimes. I can't stop myself.
By
Okay.
the way, we had related, there was some kind of social media rumor, I guess, out there that we were thinking of closing the landfill, so there was a big rush this morning of people trying to get out there to get their
Oh,
trash in before the
any
I
accidents?
was part of that rush.
closure. So
Any traffic accidents? No.
we responded or trying to soften that message that we have no reason to believe not landfills closing anytime.
I only had to go because it wasn't open yesterday, and I drove out there with my stuff yesterday to realize that
They're never
it's not open on Sunday.
Sundays.
Well, they are in the summer.
Really?
Yeah, in May.
Ours is never open in Sisters.
Just not landfill.
Well, you know, some of us choose to live places with less services.
That's true, less neighbors.
So I have a few things on the other items. One was that email from the restorations company. Did you see that? About wanting input on, and I just happen to
I
know.
didn't print all that stuff out.
Well, yeah, and I just did. I just printed out so I'd remember to bring it up. So one of the issues we have is, there's a lot in the order that says what's canceled and what isn't. There's no mention of the construction world. And so can people, this memo was about if you're doing a remodel, you might have their house torn apart. So it's pretty, you don't really want to stop then, and so, but the whole world of construction isn't listed in the order that I can see.
And I
So
agree
can you
with-
still paint a house? Can you?
Yeah, as
can
I
you
say,
still
I mean,
build a house?
social distancing, timing of contractors, I mean, there's nothing stopping all that activity. You're not gonna have a room full of people climbing over each other at the same time, multiple contractors. But that's probably the best we can do at this point. And that's what I would, that's the
Hold this
conclusion.
board while I put the, will you come over and hold this while I nail it?
I'm referring to the
I know, but
HVAC,
I'm
the
just
plumbers,
talking
the
about-
electricians, and all the
Well,
different
I mean, all
stuff.
that stuff though is how do we don't really do social distancing in construction. It'd be a new thing.
I think that's gonna be an expectation, well, because the worker is expecting it too. There's another call, they're coming in right now. What if I don't wanna go to work today because I don't trust my coworker that's not sick or whatever? I mean, it goes both ways right now, so everybody's gotta be very serious about this. But
Well,
nobody's
yeah.
saying you have to stop a
I'm
construction.
just
site.
bringing up that person seemed to think that there was that maybe they were going to be shut
Yeah.
down.
And everybody's asking that question.
And I don't know how we clarify that or,
I guess we referenced them to the order. It didn't address construction.
Yeah.
The governor said yesterday on our conversation with our side of the state that construction could continue because we are in such a housing shortage. It is an emergency that our housing shortage. I did note,
Just don't cut the hair while you're there.
don't have an
Yeah.
emergency where you have to go to the hospital.
Yeah,
That's
that's
the
that
important
too,
thing
yeah.
to say. Now is not the time to do anything where you need to go to the emergency room.
and then another one is Candy Botham had sent us stuff she's working on. I didn't know if that was something we need to deal with or,
Just advisory, I mean,
we are their advisor but did you read her email?
not the last one.
Let's see if I can find, here it is. Well, it's some letter to the, 4-H families and partners.
I think that's just CCing us, because as I say, I mean, I've been involved with 4-H for many years. We don't have any decision space there, I mean, other than the budget annually.
So she's not asking for anything from us, she's just keeping us in the loop of what she's doing.
Yeah, I haven't read that one either, but I mean, I'm just letting you know, there's a relationship there, so she's CCing us.
You're the governing body for purposes of just simply the dollars coming in through the taxing district. To the extent there's any oversight, it's by OSU.
And it would probably boil down to facility. It talks about the weighing the animals or something?
Yeah, it's
Yeah,
about
'cause that's-
tagging and weigh-ins.
That's usually a train of pickup trucks and trailers that set up like 8 in the morning, and everybody just works their way through real slow, and I've done that many years in a row. So, yeah, she's got a lot of
Airtime, or
logistics.
is it now?
Nope, it's now, so
Gotta
when you get a
check
new
in and
animal,
See how your animal is doing.
yep, a new animal,
got your
a young weight,
goals.
and a tag in the ear, yeah.
Okay. I had horses, we never weighed them. Anyway, okay.
Well, gosh,
We want those pigs to get 2 pounds a
I
day or
know, I
whatever
know
it is,
it.
yeah.
Okay, and then the other was the email from Roger Lee. Are we supposed to do something with that? About manufacturing, he wrote it before the meeting yesterday. I haven't talked to him.
and that was,
That was
Roger Lee from
governor's
EDCO.
call.
yeah, that
You're
was,
right.
that was forwarded to the governor, how critical manufacturing is. Mayor Endicott went over it with
Yep.
quite a few of his different manufacturing, in Redmond, and how critical they are, and how they can rework how they work, their social distancing. So it seemed to, it did seem to be something else that she understood, along with agriculture, that we have to keep it going.
So before today's order, I did respond to Roger on that through email, just said, yeah, so just social distancing and whatever. So, and that was before today's order, but I think it's still available, manufacturing, traded sector businesses can do what they need to do.
Somebody did let me know yesterday, though, that Deschutes Brewery had laid off 110.
Jeez.
110. So we need to get this going short term.
Well, somebody
That may be
told
economic.
me that.
Well, no, the restaurants,
Who sent out the
Yeah,
thing
yeah.
about Epic?
Oh, yeah, that was,
Crap.
I got a call from,
that was,
You that got a call?
Yep.
yes. That was last Friday, right?
300 people or something, and.
Well, I think they shot everything down because nobody's ready for a plane order right now.
So the last thing I have on my plate here of paperwork is the one from Finley sent out after today's morning, that spreadsheet. I haven't looked at it, but it was, I think he was asking, do we want to have, if you want to have input on any of these legislative priorities, we need to have it in by tomorrow afternoon, is what the email said.
Yes.
So I don't know, I'll take a look at these, I guess, and see.
Okay, and thank you for printing those out.
So this will be interesting, the negotiations that happen at the legislative session, if they have a short session, or this interim COVID committee, because there will be negotiations happen between, legislative people that are going to matter. So it's probably pretty valuable to be up to speed on this, and this is where our legislative, council can help us, and communication is going to be real important. And the dynamics haven't changed because we haven't had an election since the short session, so the same, majority-minority situation is going to be in place.
Yes.
I guess Phil had texted me while we were sitting here, Pac West. I wonder if he's seen this list or is involved in it at all. Whitney, do you know? I told him to get a hold of you. Oh, good.
There you go.
See, we're multitasking right here.
That actually is the next item on your formal agenda is the legislative update. So I don't know if you want to have me hold the updates from Bill. I know Nick was also going to come back over across the street because he had a few updates he wanted to provide under that item as well. So I don't know what would be most helpful.
Well, this is really from Finley's call this morning, saying he's on this interim committee on the, whatever it's called, on coronavirus, and he had a meeting starting today, and this is kind of the legislative agenda for that committee. Have you seen this?
I haven't seen that, no.
We can get you a copy. I think I only had 3 printed out, but it's a little bit different than our legislative. I mean, we don't even know what's on this yet. These are things that this little committee's come up with, or big committee. Okay, well, that's my last thing on this stuff, on the BOCC other items.
Do we have any other items, Commissioner DeBonne?
Just a couple kind of loose ends. So there was a variant setback request by a resident. I don't know if you've spoke to her or heard from us. So the approval was sent. There's a 12-day appeal period. She was, upset that there's another appeal period she had to wait for, but I talked to her today, and she was real happy that the process is complete, except for that appeal period. So
Is that the woman who
real
got the
happy.
thing built 11
Yeah,
feet
the
in the
garage
right-of-way?
just a little close to the right-of-way, yeah.
Yes.
I haven't talked to her since last week.
Four Peaks Festival, there was a request to understand what's going on there, and I told them there's no, I called back, spoke to Howard Kopp, and mentioned that, there's no way to pull back a permit that's out there. He was trying to understand the lay of the land. So they're working the best they can with what they know.
Right. Okay. All right. So are we good to go on then with Whitney's? Did you need to say anything more?
I'm gonna get my paperwork on that stuff. We got that and the budget stuff, right? So,
Yes.
anyway,
Okay.
Mine's upstairs.
So we'll take a
Be right back.
5-minute break?
Good break.
Time to stand up. Okay. Convening?
So, the next item on the agenda was a discussion about the legislative session. It was originally intended to be kind of a recap discussion with the board about, what happened during the formal legislative session, but I think today we have updates on a few things that are happening specifically related to COVID-19 and then the potential for a special session that may happen in May. We also generally, as buckets, which I'm not sure we'll get to all of them today, but we wanted to get feedback from the board on how you felt like coordination went while the session was in progress, and also discuss the lobbying contract that we have in place and kind of get the board's feedback on that, and if that's something that you'd like to continue or explore other options. So I think probably pressing and most immediate is what's in front of us in terms of plans to address COVID-19 at the state level, and also the potential short session in May. And I think Nick has some updates from Rob that he was going to share with you on that.
Great.
Jump in. Thank you, Whitney. Nick Lelak, Deschutes County Community Development Director. We had a statewide planning directors meeting on Friday morning. I have the pleasure this year of serving as the president of that group and coordinating with Rob closely on a lot of what's happening at the state level. And Rob put the session this week that they're going to meet 2 days, as we understand it, tomorrow and again Friday, in 3 different buckets, as they described it. And I have the information from him that he just sent me again this morning. The 3 buckets, one is going to be funding. Partially it's going to be for state government. And then he has the summaries. Partially it's going to be for state government. Partially it's going to be for public health, behavioral health, public safety, sheltering and services for houseless persons, financial and other support for those that are quarantined, financial assistance for employees and small businesses, quick and efficient distribution of targeted federal dollars. And part of it also, he said, could very well be requiring, and these are the words he used, speed reductions to state agencies given the rapid decline in revenues coming into the state. So one of the 3 buckets he said they're going to talk about this week is funding. A second one is citizens relief, public relief. He's used both terms. Statewide moratorium on evictions, statewide moratorium on utility shutoffs, extend tax filing deadline, eliminating any waiting period for unemployment benefits, defer hotel transient lodging tax, match state income tax deferral with federal income tax deferral for large businesses, provide workers free community college training programs.
Nick, question.
Yes.
So what you're speaking of is kind of the scope of the whole special session?
Yes.
Okay, yeah, so not just planning director, land use, but
Exactly.
everything,
I'm sorry.
okay.
Thank you.
No, it just helps.
So, following up on that, what are all, those are all topics on the agenda? So 2 weeks ago, when we were at AOC meeting, they basically told us, Rob did, that the only things they were gonna bring to a special session were things that they had bipartisan support on. It wasn't gonna be like, we're gonna go to a session and debate anything. It's gonna be, here's what we wanna get passed. That seems like really a menu there of stuff. I mean, it's not, so is there gonna be refinement, or is that?
Can't help it.
Well, I know, I get, yeah, they can't help themselves. But so that's totally different than what Rob was saying 2 weeks ago, because I was surprised, he said, because he was really asking for Republican. He says, unless we can get Republican support, we're not gonna put, the Democrats are not gonna do X, Y, and Z. So it sounded like they were gonna have it all prepackaged, they're gonna have it, so now are we back to an open session? Because that's what I'm asking, where we're.
I think all of these pieces are in direct response to the COVID situation that we're in right now. And unfortunately, I don't have any of the legislative concepts for any of the other bills. I just have it on kind of the third topic I was going to address. So I think as Rob communicated with me this morning, it's changing almost by the hour in terms of the topics and the legislative concepts, et cetera. So what I just wanted to do is to share with you the depth and breadth of what he's shared with me Friday and again today.
This is probably the discussion phase of, hey, does this sound right? Yes or no? You know,
I wonder if that's some of the stuff that's
Yeah,
on
that
Finley's
may be this.
list. Have you seen this?
I have not seen that.
I'll try to forward it to you and Phil Schroyer.
No, we can forward this to the board as well.
This was something that Senator Finley gave us in this phone call this morning of all the, he's on that interim committee, and it's, just looking through it, it's quite a variety of topics. I mean, it's,
I mean, I think I saw the room tax about a week ago, that they were going to divert those funds, but of course, so my email back to Annette was, okay, from what date? Because we're not going to have hardly any room tax going forward.
Yeah.
You know, so, yes, can we retro it back to the first of the year and just change the directions of those funds?
they're gonna give kids diplomas even if they're under credits at the time they don't go back to school.
And then if I can just share with you the third bucket were technical fixes. So there's a lot of places in state law where, for example, in-person services are required for one reason or another, be it at public hearings or other services. The third one is that they're calling it the technical fix legislative concept. One deals with cities are required to issue land use decisions in 120 days, and counties in 150 days. They're looking at potentially deferring that. If a local community development department has an outbreak and nobody can issue the decisions, what can we do to keep from lawsuits, writ of mandamus, those types of things, for compelling counties to issue decisions if we don't have the staff or cities? So in any event, that's the only legislative concept I have, has a number of technical fixes. And what he said to me on Friday, it was draft number 7 of what they were working on, and he said by the end of the day Friday and by this morning he issued draft number 9 of all the topics. So it sounds like it's moving at a very, very rapid pace. And I just wanted to give you that snapshot of what he shared with me. And I'll continue to keep Whitney as your liaison with all legislative stuff.
Mm-hmm. Thank you.
So you didn't mention my favorite, ADUs.
So I can go to that next. Then the next session will be after the budget forecast is released in May. After that, then there will be another legislative session where more topics will be discussed. And Rob specifically said he expects rural ADUs to be in that session and to have bipartisan support for passage.
This is Jim Doherty from Morrow County, so I'm going to grab it real quick. This is Tony.
So he specifically mentioned.
Right. It's about time, isn't it? Of course, we lose our workforce, then will we need the ADUs? Okay. All right. Thank you, Nick. Whitney.
So the other two buckets, and again, only if the board wants to dive into them today, were just to capture the board's feedback on, from a staff perspective, feedback on how we coordinated through this legislative session, and then if the board would like to have a discussion about our lobbying contract. It is currently up, and so kind of what the board's direction might be in terms of how you'd like to proceed with that. Obviously, I know that since we originally put this on your agenda, a lot has changed in terms of the landscape of what we all have on our plates. So if that's something you want to defer to a later point in time, we can do that, or we can have that conversation today.
How long have they been our lobbyists, Pacific Source?
3 years?
2016, it looks like, was
2016 they started?
2016.
So 3 years,
3 sessions.
3 sessions, okay.
So we could, and I attempted to frame this in the memo that was part of your packet today, but there are a couple options. One is to extend the existing contract under the same or new terms. Another would be to potentially go out with a new RFP and just explore that as an option, or potentially, you know, if the board wanted to go in another direction apart from a contract lobbyist, that's obviously a discussion that you could have as well. But I think given the timeline, it sounds like we would want to have certainty in what we were doing by the end of the summer, so that we were prepared to have things in place for the next session. So we just wanted to start to have the conversation with the board now about how you may be feeling.
When does this contract end?
It looks like it was up at the end of 2018, and it has rolled under those current terms. It has rolled forward.
What date, though? What's the end date?
December 31st, 2018.
December?
31st.
Okay, so you're saying this contract is actually good through this December then?
No, of 2018 is when it.
We could give notice. As I recall, there was a notice provision, so we can essentially terminate it at this point.
So it's already expired, but it's rolling.
Right.
We've just kind of
It's
treated it as
expired.
implied.
So I think we've had them from 18, 19, and 20. Because 17, we had somebody else. Our lobbyist was a woman.
Our council is who we had before this one, Mark Nelson's group.
Oh, well, there was somebody that was, I forget her name, but,
Courtney.
Courtney was staff with PacWest, I believe.
oh, so the same company.
Yeah. Courtney and then two with Phil.
So you just want feedback. Well, I thought the session, for me, the session went well. I thought they're stepping up with the new bill tracker was really handy. I think it saves us a lot, and it'd be nice to use that in a regular session. Part of the reason I think it went so well is it was, as I said many times, is this compact little session that lasted 6 weeks, so, and then it was all screwed up because they didn't go forward. But anyway, we were on a good track. I think Phil's done a good job when we need something. I mean, he'll get on it or tell us who to get, or he'll check in with us. I mean, it's hard to make a lot of decisions after a short session because it was such an odd thing, but it seemed like we were on track to give input where we needed to give input, and so I was happy with that. I would probably, well, I mean, we can play out some more this year and see how it goes with these special sessions. It sounds like some of the things we may get in the special session, or so that's really the next challenge, is how does he help us with that? And because like I'd said, that comment about what Rob had said 2 weeks ago was, so maybe that's the one after the revenue forecast, that they go into it knowing what they're going to approve, having both sides. But this one here's kind of the one we're talking about, the 3 steps of, is the one that was not anticipated. So I guess we'll have to see. So my vote would be to wait until we work through those 2 special sessions, but right now I didn't see a reason to change.
Okay.
How about you guys?
There's a certain amount of time we'd need to run an RFP to.
There is. And I don't know that that's,
Oh, I think we could run them maybe a month max, 3 weeks.
and then have a month for review, so over the summer, kind of.
Yeah, to get somebody in place by September optimal,
Correct.
to be able
Yep.
to plan for the.
So that would,
The one guy that I would be interested in talking to, that I've seen over there, kind of come across, was Eric Kanzler, because when I go there, I see him there, and I know he works for the city, but he also lives here, so it's kind of a, I think, doesn't he?
Yeah, he bid on the contract.
Yeah.
Hired back
So he'd be worth considering if we were gonna do a change, just because it seems like he would really be hooked into, I mean, they have a lot, PacWest has a lot of clients, and, but I don't know. That's just my 2 bits. What'd you think?
I had a good experience with Phil Shoyers, and, you know, the calls were as valuable as they could be. I've seen legislators be more involved in the past. Right now, it's just this imbalance of majority-minority situation. It just makes it awkward for everybody. Because there's not a lot of content that, you know, our whole legislative delegation can provide. So it doesn't trace back to these guys. I mean, these guys do a good job. If we give them something to do, they can do it. So is there a decision date you needed? I stepped out for a moment.
I think the feedback I generally, we would.
I'm real positive on.
We would need to get someone, if, we would need to know and with certainty what we were doing by September so that we could have our ducks in a row. So I think with.
Ducks, definitely ducks,
Yes,
Whitney.
not the Huskies. That
The
would.
Beavers.
um,
The Beavers on a dam.
You had to say it.
6 feet away, so I feel like.
It's my fault, I know, I brought it up. Or actually, Nick's here in the room
Well,
too, so.
Yeah, so I mean, I'm very pleased with PAC.
Okay. I don't really have anything to say today about it. I'll wait and see after the next couple of months go by, what actually
Did you like
happened.
it this year or not?
I'm not quite sure. I
Well, we kind
I-
of put our cards on the table and said.
You
this is
said
what
you
we like,
did.
and
You said you liked it, and I
is
still
there
have
something
my.
you didn't like? I'm- 'cause
Oh,
I'd
yeah,
be
I
curious
still have
what
my
it was.
2 judges that,
I want to see results.
I want to see some results. You know, I like what Nick said about the ADUs, but I want to see those judges. So I heard that they were working on it, and maybe they could have worked a little harder. So anyway, I know it's on the
You're the one that
list.
visited with the governor and the chief justice.
Oh, I know.
Wasn't it
I
on
did.
you?
No, I did.
You didn't pull the, you had the whole, you
I
had
mean-
the connections out. They're not gonna listen to the lobbyists when they got the real thing.
Well, I worked really hard on it, and I'm just praying to God that we can get those two judges still, in the next little bit. And I would hope Phil would be talking to, his connections for us. I want him to keep working hard on that. It's not a time to sit back. We've got to be at the top of this.
That's helpful. So staff will circle back with commissioners, maybe individually in a few months, and kind of revisit this and then bring it back to another board meeting as it sounds like it needs to happen.
I think we should hope that we can bring it back in June. What's it, March 23rd today? So let's hope that we're in a position that we can happily bring it back.
Okay, that sounds great.
So just for my input on your input, I guess I could look at Phil being responsible for things not getting done, but our own legislators don't get it done. So, we pay Phil directly, but the whole community pays our legislators to go do these. So we have three senators, for seven?
Three senators.
Seven legislators that represent parts of our county, and, if there's anybody that I kind of get disappointed with getting that kind of stuff done, like judges.
I
That's
know
really
Phil
a
worked
big
on
part.
it. I know my new Senator Finley has worked on it. I know they've worked hard, but it's so timely, even with what's going on.
I know, but I care as much about it as you do, because from the start, but unless we can get this top to care about it,
I think Deschutes County is extremely well-known now in the legislature.
I think that we'll get it. They just weren't gonna get anything this time, my impression.
Well, no, Senator Finley said we still have a shot at it. So,
In a special session.
yeah, because it did rise up, so. 2003 is a long time to wait.
On the last note that Phil Schroers did send, he said he anticipates that reintroduced bills and associated funding will stay as they were at the end of the session, including the judges. So that's the last release. So
Thank you.
thank you.
Okay. So now, are we at the finance and treasurer's report, since it's 20 after 3? Did you,
The phone call I got, I'll just add it to. It was, Jim Doherty, Morrow County. I figured, AOC president, he was asking for a vendor that got bumped at our county, or at the Sportsman Show. Is there a status of a rebate or something? So that, he was calling to advocate for somebody. So I'll check on that for him.
you mean they're waiting for their check and they haven't gotten it yet?
Was there a rebate from the event itself, or
No, there might have been a refund of, do they have to put deposits in?
Well, so we
Yeah,
work
so-
with the organizer, not with individual
Yeah.
vendors at the event. So
Yep.
we don't have contracts or anything with individual vendors that I.
Did an organizer? Yeah, so his question was, did the organizer get a rebate of a?
I don't think the organizer got a rebate.
Yeah, their deposit was refunded.
Yeah, it's all
Well, that's, I guess that's, I'm thinking, deposit was refunded.
Right, but
They didn't get a rebate, like
Yeah.
extra money on
Oh,
top
no,
of that,
no,
yeah.
no, just got their deposit.
Their
Like,
deposit.
yeah, I mean, that's what he was asking. Was it?
Whether, maybe the refund, the organizer's been paid, but the,
And they have to write
vendors
the next
haven't?
check. So they have to put that check in their account, and then
Yeah.
they write
So
the
he-
check.
That's what he was calling about.
So, yeah, we're kind of away from it. Good afternoon.
Good afternoon. Okay, Greg Munn, Deschutes County CFO. Just do a brief overview of the financials. That sounds okay to you? Maybe we have some good news today.
This is, as of, what is it, end of
February 29th.
February.
This was rosy days.
Rosy
a month ago.
days, weeks ago. Portfolio balance, we're sitting at $238 million at the end of February. This is up by a few $1 million from the prior month and also from the prior year, and that's due primarily to our second trimester property tax collections. So I think I mentioned to you in the last month or the month before, we typically have a rundown on our portfolio, approximately on average about $7 million a month when we're not collecting property taxes. So we would expect to see something similar to this in May, probably less, but another increase in the portfolio, slight. Our income, interest income, the top right graphic there of $360,000. That's about $31,000 less than last month and about $40,000 less than the February or year-to-date February before, or as of February before. And what we're seeing, and I've mentioned this before as well, that in that last sentence there on the second bullet, while the year-to-date net interest income is 13% more than the prior year, we're coming down off of some fairly good returns on investments that we were able to purchase 8, 9, 10 months ago. The difference is declining. So last year, the average, the difference is expected to narrow as the average portfolio return continues to decline. So last month, it was 17%. This month, it's 13%. So the same trends that I've been mentioning over the last several months. All of our portfolio balances were within the maximum limits. That's in the upper left-hand box there, those percentages. The LGIP at $49.5 million is under the $50.4 million maximum, and that's something that we try to manage pretty close to keep it right up there at the top. If you look down at the yield percentages, which is going to be your second box on the far right-hand side, you'll notice that our FIB/LGIP rate right now is 2.25%. That's the pool rate. That's staying the same from last month, but as of
March 11th.
Yeah, it dropped to 2%, and I would not be surprised for that to drop again soon. In fact, I'm surprised it hasn't.
Right, you would have thought it would have.
Yep. The next line there, the investments are average. Those are everything else other than the pool. Our current average is 2.18%, down slightly from 2.21% the month before, and overall our average is at 2.2% when you pool everything together, down from 2.26%. And our maturities right now, our average maturity is just under a year. So this is where one of the challenges is presented, in that returns on long-term investments are poor or flat compared to current investment opportunities. So logic would say, why put your money away for a longer period of time when you can do as well in a shorter period of time and have that gain in liquidity? So we'll continue to see that. Turn the page. More graphics there. The most significant line on the upper graphic is the 2-year Treasury. You can see that red line drop significantly. It's been hovering down somewhere around 50 basis points now for the last week or so. So that's going to continue to drop. That's represented by the market's flight towards safety.
Jeez.
And there's worry about the coronavirus and what the long-term impacts are on earnings for companies, and folks are fleeing towards something that has more certainty to it. The market does not like uncertainty. The graph below that, again, is just the portfolio balance, and you'll see that obviously the November bump in property taxes, but if you slide to the right on any of these, you'll see 2 more slight bumps. Those represent February collections and May collections. Following page is a list of our investments in our portfolio. We bought a few items this month, and we're somewhere between around 1.5% yield to maturity to about 1.8% compared to the same time last year when we were buying at 2.9, 2.8, 2.8, 2.8. But this week with the market volatility, actually just today, bought some Toyota at 2.8% return and BlackRock Financial at 2.7%. That's going to be a slight anomaly because I think the government's going to pass they're going to pass by the end of the week. They're going to purchase more of these bonds to force more liquidity into the market. So that price will, or the price will go up and the yield will go down on those bonds.
So you said the one was Toyota. Excuse me, who was the other one then?
BlackRock.
BlackRock, okay.
A couple of opportunities just this week, which I don't expect from you, but a little ray of sunshine. Next page, dog licensing. I may have mentioned this before, but we're moving the licensing process from a manual face-to-face process to online. And we've been running that about a week now, and when I wrote this, we had sent out about 250 renewal notices, and of those, just over 5 days, we had 40 renewals online. So this is timely, of course, considering our social distancing, which is helpful, but it's also, there's a real staff time savings here and reduction in errors and lost checks and things like that that's going on that'll be measurable over time. So we're pretty excited about that. The folks in IT were real big helps, and our ladies up front are really starting to learn how to use this and implement it. Even when folks call in, we'll just run them right through the online system.
So you can't come in now and pay?
Still can.
Oh, you still can, huh?
Tax staff, one of the things we're doing there is, in the past, we've typically printed off all of our tax statements to go to our taxing districts saying, here's the amount of money that's being put in your LGIP, so they have the backup to the details, whether it's current year taxes or prior year taxes. And some folks wanted them mailed in the U.S. mail, some wanted them scanned and emailed to them. So there was several hours worth of staff work each time this happened. The bright folks in the tax office said, well, why don't we just scan these all onto the website and make them available at any time to anybody. It's one operation. It takes a few minutes and it's done. So they've created a neat little video on the tax website that shows actually how you go in and use it, and then all of the records are there. A lot of times we'll get a call at the end of a fiscal year when some of the districts are getting ready for audit. I used to do it because we're missing a couple of tax statements. Well, they're all there. So a couple of clicks and folks will have those.
Is that just wide open, publicly accessible? Mm-hmm. Yeah, because there's nothing sensitive about it. It's just how the money's flowing.
Yeah.
Great.
Exactly. So that's an improvement. On the budget to actuals report, we're running about 7.7% more in the general fund in terms of revenue year to date compared to last year, and about 7.3% more in expenses. So the trends are tying back to at least last year's trends, and it's always good to have a little bit more revenue than expense as we continue to grow. On the position control report, this has been real consistent from month to month, and year to date we're at 5.66% are unfilled, and that's slightly down from 5.87% last month or last year this time.
But just looking at that, it looks like the sheriff's office is eked up a little bit. I don't know, health service is about the same.
911 is up to 7. I mean, they've been up to 7 for a little while.
Yeah, and facilities is 5 of 20, and that's a lot.
Yeah, a couple of those are custodial positions that we may not fill, that we look to potentially contract. So we're kind of deferring a decision there. It's not that we're...
They pay a competitive wage? I mean, that kind of... do you happen to know what the scale is for those positions?
Not off the top of my head. Do you know, Eric? Yeah.
I mean, it's in the budget book. I was just curious.
The whole field has been sort of in flux last year because the state's passed rules that mandate you have to hire certain firms that employed developmentally disabled folks, that you have to kind of give them the first crack at the contract, so it's not just a pure market-based solicitation for custodial contracts like it was in the past, so we're kind of watching that closely.
911 is really high.
Yeah,
It's as high as it's been since I've been here, I think. Used to be in the above 10 sometimes, but
really?
for 2 or 3 years. What do you think that's about, Tom?
Well, I think they just kind of come and go. I know they hire them in groups, that they then run through their training through the DPSST, so I'm not sure if that training has been deferred, but I thought Sarah said recently that they had a new group coming in. We can report back.
They just closed a recruitment a week or two ago because I had somebody contact me. They thought they could apply, and so I contacted Sarah, and she said, "Oh, we just closed a recruitment." So there's probably a cohort going through now.
It looks like they might do that once every 6 months.
Yeah.
Just by looking at the numbers, if you look back to August of last year, the Enfield was almost 6.5, and then it dropped, and then it picks up again.
Okay,
Any other questions on the FTE?
no?
All right. On the detail, I'd like you to turn to page 58, unless you have
Well,
questions before we get to 50.
Yeah, maybe.
50.
We're on 33. So TRT, this is going to crash the next 3 months, so I don't expect us to be,
Your 33 is my 58.
Yes, that's right.
Is that right? Okay.
Yes.
That's-
I know, I can't find page 58, so.
Packet page 58.
oh, it doesn't
So
say.
we only go up to
Mine's
page
packet-
55. so-
My package page is 33.
Yes, that's what we want to be on.
I'm on the TRT, let's just say that.
Okay.
No, I'm on the big one. I'm on the budget to actuals countywide, countywide, I mean. I was just looking at some of these projections of being over on some of these departments, and TRT is one of them. CDD might, that could be affected.
Right, it would.
Solid
already-
waste could go down.
Nick just said he had like 60 new permits that came in already
Right.
this week, so, yeah, I mean, they're
16.
not, at least so far, it hasn't panned out, but yeah, you're right.
But I mean, if they really flood the economy with a couple $1 trillion, then things resolve in a month, maybe not, but. Typically, when the stock market would go down that much, it would cause a bump in building. I mean, because a lot of people are discretionary building. I mean, they're building discretionary homes and lose a third of your assets. I just was thinking about some of these departments and whether others ones will change.
Do you have any specific questions?
No, I just think by next month, we'll probably need to look at those projections again and say, there's several departments that do seem to fluctuate with the economy. Okay,
I'm on packet page, well, mine might not be the same. I'm on TRT Fund 160 / So, as.
so where, does anybody know where that is?
You look up here in this upper corner, it says TRT 170, 160, 170.
Well, I'm just trying to find a page.
Mine's packet page 58.
No.
On all these dates here.
That won't.
Yeah, let's see. You're the last to know. You're the head of the department, and you're last to know.
It's page 38.
Page 38, okay.
Well, we're missing a lot of pages. That you've got 20 pages more than we do.
Yeah.
Oh,
Changed all the pages.
okay.
Oh, gosh.
All right, now we're on, so our page 38.
I owe you. I owe you. Let me know what kind of coffee you like, and I'll get you one. Pretty big concern on room tax activity, or room activity generating room tax. So I've worked with Julia from COVA, and we've had some conversations with a couple of the folks that are in the industry, that are in the know. I'm thinking of somebody from Eagle Crest. I don't remember his name. It was, I think, it was the conversation we had at the IAC. With that information, we've come up with a new projection. She's obviously really interested on the impact on the contributions from the county, distribution to COVA. And right now, it's subject to change probably almost daily as we move forward, but we've reprojected the collections for the last 3 months downward, a 90% reduction downward. So 10% of what we thought we were going to receive the last 3 months.
What, you mean January, February, March, or last 3 of the year?
The last 3 of the
March, April, May?
What about March?
April, May, June. Well, March's collections are based on February's earnings. So March, the month of March, April, and May, which would be received in April, May, June. And we're on a cash basis for this. We don't accrue back. So those would be projected forward at 10% of what we thought we were going to get originally. And then moving forward into next year, the overall average would be 80% of what our original projection was. So there's a real feeling that the market for lodging, hotel spaces and whatnot is going to rebound next year and back to normal. At least that's what they're thinking right now. So what that means on these financials you're looking at is you see the room tax projection of $8,428,000. We're revising that down. It'll show at the next report, this is all new information, of $7,266,000.
So we're going to go from 6.7 actual right now, and you're saying by the end of the year, it'll be $7,266,000.
Right. And so
or within a couple of months.
Yeah. So we've talked, that would be the collections for the year.
Right.
And
That'll become the actuals at the end of our year.
that will be our new projection number.
Jeez.
So we had been talking about a 12.5 or 12.6% annual increase from last year.
That's what it was running.
Yep, that number will be down. That will be, if this at the 7.2 million, this will be a 4% decrease from last year. So we're going from a 12.5% projected increase from last year to a 4% decrease. Last year.
Because of a strong beginning of the year and a very weak end of the year.
Yeah, yep, super strong, and then it just drops
Yep,
off.
okay.
So we'll keep our eyes on that, and I'll update you as we know more.
So their budget is currently that $2,664,000, right?
Right.
And they've gotten 83% of it. Now, are we required to still give them that 2 million?
No, theirs is a share of that, so there's an impact.
I mean, you have a note to the side of less than 195,000.
Yeah, so I've been working with Julie on that, so she can work with her board and her planning and how they're moving forward with it. In fact, I'm gonna call her again as soon as we're off here, just to make sure that she's got the exact right number she needs to report to her board.
I noticed that the state travel person made like 400,000 a year, and the head of I think he had 65 employees, and the head of DHS has 8,500 employees, and they make like 200,000 or less. Yeah, so somehow travel,
Well, one makes the state money and one spends money.
oh, is that the difference?
Yeah, it's like the football coach versus the university president. That's how they justify it. I'm sure that's how they justify it.
Well, the coaches do make a lot of money.
And they bring in a lot of money, and that's probably why the tourism guy, but, yeah, I noticed it too. They were criticized in the paper for doing that.
Yes.
So I'm on the COVA board. Tom is also, we attend the board meetings. It's been just to kind of an easy ride for the last 6 months, obviously, and it's going to change drastically now, though. So, I'll be at the meetings, we'll learn about it, and we'll, support our lodging operators and have these good communications. So, yeah, it'll be important that we're up to speed as a board also if there's any changes, so we can let them know.
Well, yeah, it's interesting, because 3 months ago, there was, and prior to that, there was a lot of talk about, well, we're spending too much on marketing for tourism. We may have to spend more to get people to come back if, I don't know, we'll see.
Yeah. Well, just dialing in the system.
Especially this year, that's
Well,
interesting.
And the first fact to understand is that 50% of the room tax revenue comes from Sun River Resorts, which is closed for 2 months. 50% of our numbers come from them. That's a huge driver. So let's hope they can come back soon.
I wanted to mention that to you, and I also want to mention Fund 615 in your packet on page 51. This is the fair fund. And I think we've talked about this in the
Yeah.
past. But if you look at the projection, the bottom line projection of minus 380,000, right hand all the way down to the bottom, the fair's going to get hit pretty hard too, and they've had cancellations of Arena Cross. They've had some training events that have canceled that have reduced their revenue. Building rentals, and not only that, but what comes along with that is a loss of food and beverage. So this couple of the items up above, the 85,000 reduction at the very top right corner and the $38,000 reduction have to do with cancellations. I just want to let you know that
It's going to go lower than that.
Yeah, and I just want to let you know that I'm working with Jeff on that as we move forward to come up with some resolution, and I believe that this will be tied into probably the budget proposal that'll come in May. So those are the two hot spots that I see that I just wanted to make sure I brought up with you.
Well, having just gone through, the discussions last week about, canceling most of the events the next month being canceled, look at the next 2 months. I mean, it affects, other things too, probably, like rights and signage goes about. Doesn't that come somewhat during events, or is that just stagnant signage?
I think the bulk of that is like the annual sponsorship, like the event center signage and naming rights.
So I don't know. I mean, the other side of this, Greg, is we actually got the line item budget, which is what I'd been asking you if we could get it. They actually had it at the last fair board meeting, so I've got a copy of that. But there's also the issue, this would be one where personnel costs, material costs, marketing costs could all go down. I mean, there's not much reason to market I don't know, seems like those could all go down if we don't have events. I mean, we're going to do some things temporarily, but if.
I do know that Jeff is working on that because we've been having quite a few emails back and forth. For example, he has an employee who's retiring at the end of this year, and
No, she's retiring tomorrow.
tomorrow. Okay.
Tracy's retiring tomorrow.
Okay. And so he hasn't. I don't believe he's going to proceed with refilling that position right now. Is that right?
Yes, they're taking a step back, and they've working with HR and what the best fit might be in terms of a different kind of position to meet their needs. But that wouldn't be till I think he's targeting the summer.
Yeah. So that will play out here in these numbers as well. So I just want to let you know that he's working on it, and I'm working on it with him, and we're paying attention to it and come back with a solution.
Well, yeah, I mean, all I'm saying is we need to do both sides of the ledger. The revenue is going down, but how's the expenses going to go down? Because
Yeah, because
it's all event driven. It's like,
they're at year-to-date 68% versus 66.7, and yet the revenue is down
48%.
48%. So, yeah, they were missing it before this happened.
That is true. That is part is partially true, yes.
So when I was meeting with Jeff recently, we all met with him, I started to kind of dream a little bit about having an opportunity. If we have less activities on site, it may be a really opportune time just to do some of the simple painting jobs or some of the projects that could be done. One of the visions was to, maybe look for a painting contractor and use our staff to support that contractor, so there's one person spraying, one person supporting them, 2 people in a room, so we could do a project like that, get some painting done and, be social distance also.
Yeah.
The problem is they're not gonna make revenue and we'd be having to spend money to do that, so it's,
But you're saying instead of just laying off people,
well, yeah, instead of just stopping, maybe investing is the opportunity we have. So that's a discussion to be had. I haven't run any numbers on that. It's just a vision.
So the person that's leaving, what's their salary gross? Does anybody know?
She was here for a long time.
30 years.
Yeah.
I mean, I just wondered, are we,
The last 4 at Fair and Expo. She
Yeah.
was in HR for most of that time.
Yeah.
I don't know it off the top of my head.
okay. Just wondering.
Any other questions?
well, so another one, just to be thinking about it, we don't have any projections yet on revenue, but solid waste would be another one that typically goes down if we go into a recession. I mean, we definitely increased a lot over the last 5 or 6 years, and before that had gone down to, so that's something to, everything's still just showing as originally projected. He hasn't, so that'd be something to be thinking about. The next, be interesting to see how much there's, because people don't buy as much, they don't have as much garbage too. And you don't.
But at least his resources at 68% and his requirements are at 51, so,
I think a lot of that has to do with construction debris, actually, is a pretty large percentage, and that's where the economic trends really marry into his volume. For the most part, domestic garbage, unless there's a big exodus of people moving out of the county, is a little more consistent than the construction
Well,
demolition debris.
and like even Nick saying that he has these building permits coming in, those are all people that have been planning for months to do something, or, so now, huh?
They can finally get a contract.
Yeah, so they find, yeah, but, usually before, we would slow down a year after California slowed down. So the market it would lag a year of California. It was really typical. Plus, we, even in the recession, we built all the way into 08 and into 09 before, it was really in 09 that things fell off for new houses. All these other people are up and running. So it's gonna be a while, so construction debris might not fall off this cycle, but.
speaking of money, what about our marijuana money? Are we still pursuing that? Have we heard feedback?
Well, actually, interesting that you ask. We received a very cryptic voicemail, actually, Tom did,
Cryptic.
that seemed to indicate that we would hear something. We then received a very cryptic letter from OLCC, and neither of which really gave any type of definitive response. So we have generated a new pleading that we sent to DOJ, OLCC, DOR, demanding that they provide us with a formal response within a designated timeframe. Otherwise, we'll file in circuit court for a writ to demand a declaratory ruling. So there's some procedural issues. I suspect a lot of it's being driven by the virus and the fact that DOJ and DOR and everybody else is probably focusing on other issues right now, but we're on top of that.
Okay, I just wondered because they'd
Well,
received.
we haven't gotten any.
What do you mean by cryptic if they didn't say what they were doing?
Well, the voicemail that Tom received basically said, yeah, you'll be hearing something. And then the letter we received sort of said, yeah, you'll be hearing something.
Oh, but then
But we haven't heard anything, and meanwhile, the clock keeps ticking on an administrative procedures challenge, so we're holding their feet to the fire and telling them, if you don't give us a formal thumb up or thumb down that we can challenge through the administrative process, you leave us no option but to go to circuit court on a writ to procedurally protect our rights.
I think that you're right on the DOR voicemail. It just says you'll be hearing from us probably next week. That was in mid-February. And then the letter from OLCC said actually that DOR's already determined that you're not getting anything.
Right.
And which was just kind of a complete
Right.
disjoint.
DOR's had no communications with us, and DOJ's had no communications.
And why OLCC would feel compelled to say that is just kind of, it is cryptic and mystifying. But they did say you ain't getting nothing in that letter, which is why we're kind of all over it.
Okay. Well, let's stay on top of that one.
We are, and like I say, if we don't get the timely formal response from them, then we'll go ahead and file the challenge in circuit court.
One, just kind of keep on your radar, a big implication of that is the two sheriff detectives that were funded
Right.
with that
For a-
money. So I had the meeting with the sheriff budget crew last week, and my advice to them was to include those positions in the budget for next year with a zero in terms of the marijuana tax, and then that's going to be a policy decision on whether you want to continue to fund those or whether the sheriff can afford to absorb them or what come budget time.
Well, they sure had a lot of cases.
It's been wonderful.
Well, I think we'll probably, I'm going to support them for another year. I mean,
I figured you
regardless.
probably would. That's why it kind of directed me to say what I said to him, but it will be a decision.
Remarkable what they've found
Yes.
in a place where everybody says it's not going on.
Oh, yeah, it's unbelievable. When was our last marijuana check then? The one we didn't get was in what, September or something? Is it quarterly?
Last one we got was in like October.
We did get a check in October?
Yeah, that was for.
Remember I was saying if we put this off 2 more months, we can get another check before it goes back.
Okay, last check, okay.
We've got another. I think we'll get it.
I
We'll
cannot,
have to pay it.
they'll have to pay it.
Or we'll have to, that'd be a short topic, or a topic for the short session if they don't want to pay it.
Yeah, good idea.
I was noticing on, what's our page, 53, I think it's 50, yeah. The risk management, it looks like our property damages has gone up a lot, but then it was, on the other side, I think we got more claims reimbursement. A lot of that probably has to do with that roof, or the roofs at the fairgrounds. Did you ever figure out, did we do better than we would have done if we had done that emergency order in 2017?
You know, my recollection is it's pretty close. I'll be happy to look up the exact numbers for you.
Should have been, we thought it was gonna be a couple $100,000 different.
I think part of it is the roofers were busy for years on end, you know, the roofing companies, repairing all the roofs throughout Central Oregon.
Didn't we use a Portland roofer to do it, or did we end up using a local roofer?
We used Northwest Quality Roofing, which is a local company. I'll get you the exact numbers of the.
I'd just be interested to see, it was a big to-do.
Oh, Greg, I know I asked you what it would cost us if we deferred that May property tax payment. It doesn't look like there's very much left.
Correct.
It's just a little bit of money, isn't it?
It is, and I haven't.
You haven't had time to do that, I know.
It's the smallest collection that we have, and out of the 100%, whatever that collection is, we turn over about 80% of that to our taxing districts. So we keep 20% of the smaller piece.
So we'd be speaking for a lot of districts if we had that conversation.
Yeah. But I have a note. I will get back to you on that.
Okay, thank you. I just thought if we could just give them, people that pay like that must be really watching. You know, they can't take the discount, the 3%. And, maybe they're the people with the restaurant or whatever, they're the people that have a house, but they're having a hard time. And if we gave them 2 months, till July 15th instead of, is it May 15th they have to make that payment by? Yeah, it was a thought. I mean, I just feel like those are people that maybe are, impacted, and if we could help them.
the authority to do that at the local level?
I think it's driven by the state, but I couldn't tell you that for sure. That's
Okay.
part of the question I want to make sure I ask for you.
One of the thing is reduction of the property tax in November.
Right, exactly. Oh, yeah, it looks like that will definitely be on our future agenda.
I believe somebody could not pay their property tax and then just, there would be a fee, there would be a fine associated with that. So that would delay their payment, but there would be a fine associated with that, and we may have the ability to
Absolve the
waive the fine.
Okay, okay, well, if you can let us know. That's,
It's a learning, it's a little bit, it's new to me, so I need to kind of dig into it.
I know, if they're giving a moratorium on evicting people or paying their utility bills, you know, it's something that, as the county, we could help.
We actually have a call into the fellow at the state that's the expert on all this, get that answer.
Okay, okay, thank you so much.
So another one I saw was on the CDD is they have put in their reduced expectations for permits and 150,000 on building safety and electrical, below budget is what they're projecting. Current planning 63%, so that's. Then, oh yeah, and then current planning also, so quite a bit. $200,000 less revenues than we budgeted. They must have updated this since last month.
Yeah, we reach out to all the departments once a month and ask them to update the
Yeah.
projections, so.
I don't have any other highlights. Do you have any other highlights?
No, that was it.
Mr. Devon, did you have any questions for him?
No other questions?
Okay. Thank you very much. Thank you for
Welcome.
being so patient. Okay, so we have, how many minutes? Oh, till the next,
I've got a phone call at 4:30.
Right. yes.
You know, one thing, Tom, we're going to have to, seems we're going to have to look at with regard to, I don't know, what was it, budgeting. Is that some of these state, we've gotten a lot of state and federal grants on health. And, you know, I don't know if everybody keeps funding like they've been funding, if they spend a couple $1 trillion on all this other stuff, whether they're gonna keep, so things like the CCBH, it's gonna be interesting to see what they change, if anything, and,
We're gonna do things a little bit differently with the health department in the coming year. We're gonna, because every year we have unknowns on what's gonna happen, is just as you say, in terms of state and federal allocations. So we're gonna try and do much better in having contingencies, kind of what-ifs that we're gonna present, and hopefully we'll be able to do that at the special advance meeting next month in April, and give you a sense of kind of where the biggest moving parts are and what happens either way if a piece of funding either does or doesn't come in. That's the plan.
well, some of it we probably won't even hear until, I mean, the
No,
question is gonna be so wrapped up in everything else, yeah.
We won't, and because of the timing of the state funding and the federal fiscal year, I mean, that's exactly why we're doing this. So we'll identify when those points are, when we think we will know, but we'll kind of have a plan one way or the other, depending on whether things do or don't happen with respect to funding.
Okay. Is there any additional business?
We had one executive session for property, if you have time.
Sure.
I think there was, the memo was put in your basket, and that was just checking on Overton Drive. That's the parcel that the city of Bend had asked for the street right-of-way.
Executive, yeah, we,
Okay, we need to
taping, so we would.
turn off our tape.
I think it says the 25th.
It says March 25th is what it
I'm
says
sorry,
on
we
it.
didn't change the date because we